Okay, folks, we have a busy agenda today, so I'm going to call this meeting of the Standing Committee on City Finance and Services to order. Madam Clerk, may we have the roll call, please?
Mayor Robertson is not in the chamber. Councillor Louis is on a leave of absence. Councillor Stevenson is not in the chamber. Councillor Deal? Here. Councillor Jang? Here. Councillor Reimer? Councillor Meggs is in the chair. Councillor Ball? Councillor Carr? Here. Councillor Affleck? Here. And Councillor DeGenova. You have a quorum, Mr. Chair.
Thanks very much. Given the important matter that's upcoming, Mayor Robertson's on his way, but I think we will go straight into it. I do want to acknowledge first that we're on the unceded traditional territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations, and appreciate that fact. We have a proclamation for National Seniors Day. Mayor Robertson's on his way, but perhaps Deputy Mayor Deal, you could do the honors.
I don't think so. The Seniors Advisory Committee is an important body that helps the city to understand and respond to the needs of seniors in Vancouver. This committee is integral to us being an age-friendly city, a provincial designation which we were awarded in 2014. Today I would like to celebrate all seniors in Vancouver with this proclamation on National Seniors Day. I would like to invite two members of the Seniors Advisory Committee to join me to receive this proclamation, Mr. Scott Ricker, who is Vice Chair of the Seniors Advisory Committee, and Dr. Brian Tucker, who is Chair of the Subcommittee working on a project to reduce social isolation and loneliness among seniors. If I could have the two of you come up to receive the proclamation. There you are. And for anybody who doesn't know, we have lots of advisory committees here at the city, and we're always looking for active volunteers like these two. Come on around. I'll read this out to you, please, and then give you a chance to say a few words. The Proclamation of National Seniors Day. Whereas 14% of Vancouver's population are seniors aged 65 plus, and over the next 2 decades, the number of seniors will increase significantly. Whereas on October the 1st, communities across Canada will join together to recognize National Seniors Day. And whereas seniors in Vancouver are present in all aspects of our lives, they are our parents, our elders, our grandparents, our teachers, our volunteers, our mentors, our neighbors, and our co-workers, and us. And whereas National Seniors Day focuses on celebrating and recognizing the contributions made by seniors to better their communities, families, and workplaces. And whereas every day seniors right here in Vancouver make a big difference and we value what they are doing. And whereas the Seniors Advisory Committee, in collaboration with Vancouver Coastal Health and the City of Vancouver, will launch an initiative to increase social connectedness for isolated seniors, develop a process to increase capacity of staff and stakeholders supporting seniors to reduce social isolation and loneliness, that will inform the social infrastructure plan and refresh the age-friendly action plan, and support the goals of the Healthy City Strategy with an emphasis on creating social connections. Now, therefore, I, on behalf of Gregor Robertson, Mayor of the City of Vancouver, do hereby proclaim October the 1st, 2016 as National Seniors Day in the City of Vancouver. Excellent. Congratulations. We'll do a quick photo and then we'll have you say a few words. Let's come up from behind the podium.
We just heard that 14% of Vancouverites are seniors. On television over the last few days, I've watched Eastern European countries where there have been the formation of senior citizens parties. And the pensioner parties have now become represented in the national assemblies because they've reached that percentage of the vote. And that's a sign of things to come in terms of the increasing number of seniors and the activity level of seniors in this city and in Canada and throughout the world. And the way to overcome the threat that may pose is for the existing parties to integrate the concerns of seniors into their platforms. And I hope this is what the city is doing.
Thank you.
I would just like to thank Council for their support. both ongoing and in the past. And I would like to tell you about a party that we're having on the 1st of October. It's going to be held in the West End at the Jim Diva Plaza at Davie and Butte. We're putting together what we think is a pretty good package. It'll include free food, hamburgers and stuff for seniors. Everybody else will have to contribute. There'll be a book exchange, and I would extend an invitation to all of you. And finally, I just wanted to, this is Deli Lidyard. She's a member of our Seniors Advisory Committee. She's a moment late, so could we get a picture with her in the picture? Please.
Let's come on over here.
Just so she can prove to everybody that she was here.
Thank you so much for that, and thank you for all of your volunteer work and for making the city such a great place for all of us.
Thanks. Thank you very much. Yes, and thanks for all the work of the Seniors Advisory Committee. So we'll move on to the regular agenda. As chair for this meeting, I'm suggesting for reports that have no staff presentations or speakers, we adopt the recommendations collectively in a single motion. There are currently no staff presentations or speakers for items 2 and 3. Does any member wish to hold any of these reports for debate, separate vote, or because of conflict of interest? Not seeing any hands. So we need a motion to adopt the recommendations contained in items 2 and 3. Moved by Councillor Carr, seconded by, oh, we don't need a seconder. Thank you very much. So all those in favor, please show. Any opposed? So we have adopted item 2, which is Annual Financial Authorities 2017, and number 3, the debenture program for 2016. So now I'd like to welcome a number of experts to the podium. Dr. Patricia Daly of Vancouver Coastal Health, Dr. Mark Lysician, and then of North Shore Coastal Health, and also Chief John McKerney of our fire department. And he's with Assistant Chief Scott Morrison and Deputy Chief Lawrence Rankin of the police department. Scott Morrison's with our fire services. So this is an important presentation. It's a brief one. What I'd recommend to council is that we hear the presentation and then have a round of questions to any of the presenters, and then they can get on their way. They've got a busy schedule and a major problem they're trying to wrestle with. So Dr. Daly, do you want to lead off? And thank you so much for coming.
Thank you. And I do have a presentation. If we could get it up on the screen, I can start. A few months ago, I came to council, and thank you for the opportunity again to talk to you about the public health declaration of the overdose emergency, and declared by Dr. Perry Kendall. And since that time, you have probably seen many media reports about the state of the emergency. I can tell you from the coroner's office, we know that in 2015, there were 505 deaths from illicit drug overdoses in British Columbia. As of the end of July in 2016, there have been 433 deaths. So you have probably heard in the media that we're on track to have an increased number of deaths this year provincially, despite the declaration of the emergency in the spring. And of course, we know that the primary reason for this rise is the widespread presence of fentanyl in our illicit drug supply, particularly our heroin supply. This is also data from the coroner's office, which shows among those illicit overdose deaths, the percent where fentanyl was detected. Most of these deaths, those who died have multiple drugs in their system, but this just reports on the percent that had fentanyl. And you can see low numbers in 2012, but continues to rise almost exponentially with a majority of deaths this year having fentanyl associated with them. However, the media reports about the ongoing increase provincially don't necessarily tell the story about what's occurring here in Vancouver. So I want to give you a little bit of data that highlights what's going on in Vancouver in comparison to some of the other municipalities around the province. So I'll walk you through this data. The first column shows the number of deaths from illicit drug overdoses in 2015. This is data from the coroner's office, and you can see that in 2015, Vancouver did have the highest number of those deaths. The third column is also from the coroner's, and this is on their website. It's the number of deaths that have occurred up until July of this year. So you can also see that with 78 deaths, Vancouver is at the top of that list. However, If we look a little more closely at this data, the column in the middle, the expected deaths, is calculated as data that I've calculated, assuming that if we'd had the same death rate for the first 7 months of 2016 as we had in 2015, how many deaths might we expect to have seen? And then I've taken the observed deaths, the ones that actually occurred, divided it by the expected number to get a ratio. So to explain this further, in fact, in Vancouver, if you look at, if we've had exactly the number of deaths that we would have expected, which means the death rate has been the same in the first 20 months of 2016 as it was in 2015. There's been no increase in that death rate. So despite the rise in illicit overdose deaths and rising rates provincially, we have not seen that in Vancouver. We've seen basically a flattening of the death rate, no increase. Of course, we haven't yet seen it decrease, but that's good news compared to what's occurring in some other cities. So if you look at this column here, the expected number of deaths in the other cities that the coroner has reported on, and look at what actually occurred for every one of the other municipalities here, the observed deaths are higher than what we would have expected based on last year's death rate. In other words, their death rate is increasing, and it ranges from a 20% increase in Maple Ridge to a 550% increase in Kamloops. So in Kamloops, if they'd had the same death rate, they would have had 4 deaths up till the end of July. They actually had 22, 5.5 times as many. So it's good news that you may have seen Kamloops City Council has supported the Health Authority proposal for supervised injection services in that community. But other communities, Victoria, a 3.4 times increase in death rate. And if you look at a city like Kamloops or Nanaimo, where they've had approximately 20 deaths up till the end of July, given their population is about 85,000, we have about 7 or 8 times the population in Vancouver. We actually have a lower death rate from drug overdoses to date in 2016 than a number of the other cities across BC. So in a sense, we're happy that we've been able to stop the increase in drug deaths. Of course, all these deaths are preventable, so we want to eventually see the death rate come down. This is not meant to be critical of other cities. I think one of the reasons why we've been able to hold things and not see an increase here is because we had more services available to start with, harm reduction services, very good addiction treatment services in the city of Vancouver. We've been able to augment these. Many of these other municipalities didn't have those types of services, and they're now working very hard to implement them. It doesn't mean that we don't have the same problems here in terms of the contamination of the drug supply. In fact, my colleague, Dr. Mark Lesician, did a pilot project at Insight where people had the opportunity to test the drugs they brought in to inject. And that pilot found that of those people who brought in what they thought was heroin, 90% of the time it tested positive for fentanyl. So we've been able to hold the death rate even though our drug supply is overwhelmingly contaminated with fentanyl. In fact, it has replaced heroin on the streets of Vancouver. So good news that we've held things as they were, but of course that's not good enough. We do want to see the death rate come down. So what have we been doing since the declaration of the emergency? Well, number one, our first response was to expand access to naloxone, which is the antidote to opioid overdoses. It's tremendously effective and very, very safe. We had a program in place in British Columbia for a number of years called the Take Home Naloxone Program. Dr. Lesician is going to demonstrate this to you. These are kits that are given to those who are addicted to injectable opioids. That allows them or one of their peers to respond in the event that they suffer an overdose. We have dramatically expanded the distribution of those kits. Vancouver was already the #1 site for distribution in the province before the declaration of the emergency. As of July, we have 66 sites in the region that are distributing take-home naloxone kits to people who may be at risk of overdoses. And importantly, we've included in that our emergency departments. We know that 85% of the overdoses that come to emergency departments in our region come to St. Paul's Hospital. Nurses there can now, those who come in and suffered an overdose, give them a kit. They're at very high risk of another overdose, train them how to use it before they're discharged. This has also been implemented at Vancouver General Hospital, and it will be at all the hospitals in our region by this fall. We've also started to distribute these kits at all of our community health centers and mental health and substance abuse programs to the clients there. Dr. Lesician has also led a pilot project to train staff working in supportive housing to be able to administer naloxone, and there's been quite a large number of reversals of overdoses as a result of that, and we intend to expand that program. And you'll hear from the VPD that they've also now got access to a new form of naloxone that is, can be administered intranasally, so not with injection. The other thing we have done and we intend to expand further are supervised injection services. So you recall we have the only legalized supervised injection services in North America at Insight, the Dr. Peter Center, and at Crosstown Clinic, which is operated by Providence Healthcare. Beginning in August, Insight, which is open 18 hours per day, 9 a.m. in the morning till 3 a.m. We opened it 24 hours a day for 3 days a week during the week of social assistance check distribution, because we know that that week we see a rise in overdoses. And in fact, in August, we had a significant rise. In the first week we did that in August, we did see approximately 100 people visiting Insight during that additional 6-hour period overnight. So we intend to continue this initiative. But we are also going to be applying for more supervised injection sites in Vancouver. And the applications for the first 2 sites are going to go in within a month. They will be at the newly announced Mental Health and Addictions drop-in that will be opening in the downtown east side. This will be operated by Lookout, and it's funded by Vancouver Coastal Health. And the second location where we will submit an application is the Heatley Community Health Center. It's a former Strathcona Mental Health Clinic operated by Vancouver Coastal Health. But there are a number of other locations both in and outside the downtown east side where we intend to submit applications for those services. As you know, it's a lot of work to submit these applications. We appreciate the letter from the mayor to the Federal Minister of Health asking for a repeal of Bill C-2, which would certainly make it a lot easier for us to begin to implement those life-saving services. But we certainly should have some of those up and going within the next few months. The other thing we've done, Vancouver Coastal Health has the best clinical addiction service in the province. This is another reason why we've been able to respond perhaps a little more quickly than some other places. Dr. Evan Wood and Dr. Ron Joe are our provincial and probably national leaders in addiction treatment. Based on their advice, we are moving to use Suboxone as our first line of addiction treatment, replacing methadone. Some of you may be familiar with the provincial methadone program. It's a substitution program for people with opioid addictions. It requires a special license by physicians to administer. Suboxone is a safer drug. It's a very effective drug. And the college has indicated no special license is required to prescribe it. So we hope to rapidly increase the prescribing of Suboxone as a better alternative to methadone to those with this type of addiction. In Vancouver, we also opened a new home detox program called START. It's another option for people who are ready to start detox who may not want to go into residential detox. And St. Paul's Hospital has opened a rapid addiction assessment program earlier this year. In addition, we intend to open a new addictions clinic in the downtown east side, a low barrier addictions clinic. But in fact, our staff have already started to offer what we call low barrier addictions treatment. They have spots available. Anybody who's ready, if they come into Insight or anywhere else to begin addictions treatment, we can get them started immediately on addictions treatment. So these are some of the things we're doing. As I said, we're satisfied that we haven't seen an increase in deaths, but we need to do a lot more. All these deaths are preventable, and we'd like to see the rate come down to 0 if possible. So I'll now turn it over, I think, to my colleagues. I think next is John Kearney.
Morning, Deputy Mayor, elected officials. I'd first like to introduce Scott Morrison. He's a newly minted chief, come up in the Vancouver Fire Rescue Services, has done a lot of various work on behalf of our elected officials through years, and he's responsible for our medical services branch. So I just have a couple of slides on what Vancouver Fire Rescue Services has been doing in relation to overdoses in our city. So since January, as you can see, there's been a moderate increase through the end of August. So it's been growing at a fairly steady pace. We have a couple of slides here as to the clusters. The clusters is where the overdoses have occurred. The colors just represent the different numbers of incidents that has occurred over this period. So this is from January to August. This is showing the different various fire halls, the locations. I apologize, it doesn't show the neighborhoods where these halls are, but the bottom 3, number 2, of course, is the downtown east side, and number 1 is the Strathcona area, and number 8 hall is the down in Yaletown area, so where most of the incidents have occurred. If you'll recall, we did a presentation and received your approval to move into administering naloxone in February. This was noted as a crisis, and it was actually Dr. Daly and Vancouver Coastal Health that pushed the emergency health services to have first responders administer injectable naloxone. Since that time, through the good work of Scott and our firefighters getting trained, they've taken it on very solidly. They are very proud of the work they do. They've administered 51 administrations of naloxone, or different instances, I should say. In several of these instances, they actually have to administer several doses in order to be effective. But I'm very proud, we're very proud of the firefighters taking this on, because we were in crisis, and they realized that. They took the training up, and they were doing good work in the community. So next steps for us is we are certainly wanting to ensure that all our first responders, and as our partner, the Vancouver Police Department is doing as well, is ensuring that all our staff are aware of the issues of fentanyl. One of the concerns, of course, is absorption or inhalation while you're involved in an incident, and that can be quite alarming and dangerous for our staff. So we're ensuring that they have full awareness of that. And because of the strength of the drug, what we're finding is it's taken more and more injections in order to be effective. We're increasing our inventory on our apparatus to be effective. And the mayor invited us to speak on Monday, and we were looking at different ways that the Vancouver Fire Rescue Services could be effective in this crisis at the good graces of our elected officials. And I'll turn it over to Officer Rankin.
Good morning. I apologize I don't have a PowerPoint presentation. It was a rather busy weekend. I want to begin by just describing the efforts that the department has made in terms of public awareness. And this summer we began a public awareness program using both social media and traditional media formats, as well as working with the Vancouver School Board to get messaging out to parents of school children. We are part of the provincial task force in the fentanyl overdose response. We're advocating on the enforcement side for enhanced or increased interdiction efforts on the part of the CBSA, and really looking at addressing the products that are being imported in packaging and precursors. As part of the task force, we're working with the Attorney General as well as the Federal Ministry of Justice to enhance criminal sanctions specifically for production, importation, and trafficking. We're working on, in terms of interdiction or enforcement locally, targeted or strategic enforcement in the downtown east side, targeting individuals who we believe are responsible for dealing this drug at a street level, but as well at a provincial, national, and international level with our partners with the RCMP. And we are and as well working with CFSU for enforcement on clandestine labs. We're advocating for changes for federal legislation in terms of improvements on the CDSA, Controlled Drugs and Substance Act, with respect to precursor control and regulations. So we're really looking at getting legislation in place to prevent the manufacturing and sale of illicit pills, but pill presses, tableting machines, pill counters, punches, and dyes. And what we're finding is a combination of things. We're getting precursors being brought in primarily from China, as well as fentanyl. But we're also finding people that are purchasing this equipment like pill presses and making their own pills in their residences and then distributing it. And of course, the tragedy with that is there's no quality assurance, and they're finding that a batch of pills can be, for the most part, not lethal, but all it takes is one pill that has a hot spot in it, if you will, with fentanyl, and that proves to be lethal. Within the VPD, we have started a naloxone implementation team made up of a number of members of our department, both in support services as well as operations and investigations. We're going to be training sworn and civilian members beginning in October. We'll be purchasing 300 kits of intranasal naloxone for distribution to members that are in high-risk locations. So downtown east side, the organized crime section, which contains the drug section, drug enforcement section, our fleet office, property office, and emergency response section. The kits are $145 each, 2 kits per for our 2 intranasal devices per kit. And in the process, we're going to be providing training to our seconded members, to the RCMP and FSOC as well. Training is going to be in video format as well as face-to-face parade briefings. And we're already in discussions with Clayton Pecknell, the Director of Police Services, to provide our policy that we're developing, our training materials to the province to distribute provincially. That's the main points. Thank you very much.
Thanks very much to all our presenters for a really sobering presentation, but thank you also for the strategic suggestions in there. One more to go, sorry. Zach?
Mary Claire Zach, Managing Director, Social Policy. I'm just going to give a summary of the Mayor's Fentanyl Urgent Response meeting. The Mayor called together just on this past Monday an urgent meeting with the BC Chief Medical Health Officer, with Patty Daly and her staff from BCH, the Vancouver Fire Department, Police Department, and business organizations. It's part of our ongoing effort of the Mayor's Task Force on Mental Health and Addictions. And we also, prior to that meeting and afterwards, involved people with lived experience, advisors from the Mayor's Task Force on Mental Health and Addictions, who provided input prior to and following that meeting. I think we're having some challenges with the presentation, but we'll get there. The feedback from people with lived experience in any issue is really, really important to us. So I'm going to ask Karen Ward, who plays that role with us, also volunteers both with Vandu and Gallery Gachet, to join me at the podium just to go through the recommendations that came from the people with lived experience. Just get on the right slide here. We'll just proceed. Okay, we go ahead, Karen.
Yeah.
Okay.
Okay, well, I'll to speak from the community and the situation at large. There's a great deal of anxiety and upset throughout the community. It's really reassuring to hear about the statistical leveling off of the overdose deaths, but I would remind everybody that that's overdose deaths, not the sheer number of overdoses that first responders and peers are dealing with in the downtown east side and beyond. I'm very happy to see recommendations around naloxone training and that being expanded. We offered naloxone training on Monday afternoon. We do it every month before a check day, and we were well over capacity. People from well beyond the downtown east side. It's quite clear to me that there's a great deal of public anxiety around the crisis. And what we advocate at Vandu for a harm reduction approach, and that's on a very basic level of supplies and education, but it's also part of our social and political mission, which is to, we advocate for an end to prohibition and for a free and regulated drug market, so that people aren't using substances that they frankly have no idea what they are. So we're hoping to see an expansion of the street level services that are provided. We're glad to see safe injection sites that need to open immediately. And we'd like to ask for support in offering the kind of peer-based training that we do really, really well. We're as activists and as people who care about our community, it's very difficult when you're literally watching people drop on the street. And that's what's happening in our community. So we want to see things that like peer-based outreach teams that can not only take care of the use that we're seeing in alleyways and on the streets and in the semi-private locations around the city. We want to be able to reach out. We need the city support in order to do that well.
We appreciate the testing that was done at Insight last month. We'd like to see easy drug testing that can be accessed by community members. Sometimes it's just it's a little way of communicating harm reduction in an extreme situation. But I think it's something that people need to know to educate themselves about what they're doing. Training all city staff, housing providers, whether it's a privately run SRO or public housing, everyone needs to take on naloxone training as part and parcel of any first aid response. And we need to find ways with the city and ideas around placemaking and communication, letting people know sometimes that there's someone out there that cares enough about them as an individual to save their lives with a simple injection. Messaging that to people who are in dire need is an incredibly valuable and necessary thing that we can all do. Good.
Needle pickup and recovery?
Oh, yeah. Part of an outreach effort, of course, working and living as I do in the downtown east side, probably everyone's aware there's a lot, Insight's really over capacity. People are using in alleyways. There's a lot of needles. There's a lot of debris on the streets, and we want to be able to support each other in our peer-based model to help improve that situation out on the streets, and to do as much as we can to reduce all the harms that are involved, and actually get out there and let every Vancouverite know that they're cared for. We need to communicate that, and I hope that we can start with this. It's really encouraging for me to see everyone coming together to speak about this issue today. To me, we need to kind of reboot the Vancouver Agreement and really take a step. When you look at the numbers that Dr. Daly presented us with, if we're managing to be just leveling off in the face of this overwhelming epidemic of the most incredibly powerful painkillers, clearly, first there's pain that needs to be addressed. There's a situation of underhousing and homelessness in the downtown east side. People don't have enough access to food, to health care, to the treatment that they need, and the treatment on demand that is actually going to help them on their way. Thanks.
Thank you, Karen. Just a couple more slides is that some of the strategies identified, there was definitely a commitment for action, for knowledge exchange and collaboration among these partners, and 4 key strategies. One is around coordinated naloxone distribution and training to investigate opportunities to scale up drug testing beyond Insight, that's already been mentioned, and to integrate naloxone with first aid training, that's also been mentioned by Karen and others, and to support our advocacy, communication, education efforts across government and with community. Our immediate next steps, we decided that we're going to organize naloxone training for city staff and support a large-scale training opportunity in community, working in partnership with people with lived experience and our partners, and to include the business community in the downtown east side, to advocate to expedite the safe injection sites, and to develop a citywide strategy and management plan for discarded needles. And this group will reconvene in October to assess progress and identify next steps. So the mayor will convene in a few weeks' time. Thank you very much. And next, we are going to ask Dr. Lashishin to do a demonstration for us on naloxone injection and how this can save lives.
Thank you very much. I hope I can do it on this not flat surface. So when we do naloxone training, we do it on fruits such as this, a good opportunity to promote fruit and vegetable. This is a grapefruit. This is a take-home naloxone kit. So the part of training is, first of all, to recognize the signs of an overdose. So if you come across a person and they look to be drowsy or unconscious, they may not be able to speak or walk. They may have trouble breathing or be grunting or snoring. Their skin may look blue or gray. So these are all signs of an overdose. They may have a weak pulse as well. Particularly if the person is not breathing, you have to call 911. You have to get help as well. If you have more people responding, that's always helpful. Once you get to the person, we teach people about the SAVE ME step. So that's an acronym so that people can remember what to do. The S stands for stimulate. So you're going to rub somebody on their sternum. You're going to call out their name. You're going to ask them to breathe and to wake up. If they don't do that, you're going to look at their airway. That's the A. You're going to make sure the airway is open and not blocked with anything. If it's blocked with something, you remove what it's blocked. Then you're going to move to ventilate. And so in order to ventilate, the take-home naloxone kits do contain a face shield that you would open up and place over your mouth and theirs. Sometimes when there's been an overdose, there can be blood or vomit on the mouth, so you want to protect yourself from that. After that, you're going to evaluate to see if there's been any response to that. If there hasn't, it's time to move to naloxone, so that's M, and that means a muscular injection. So basically what you're going to do is you're going to put on a pair of gloves. I'm not going to do them for this demonstration. You're going to open up the naloxone. Take-home naloxone kits have 3 vials of naloxone in them. They look like this. You're going to make sure the medication is in the bottom of the vial, and then you're going to break off the top. You're going to take a needle. Ideally, you're on a surface here that's flat, but unfortunately, responding to overdoses, you're not ever in ideal situations. So you'll remove the syringe, take off the cap. You're going to put it into the naloxone vial. Draw up the naloxone. So there we've got the naloxone. Make sure the air is out. You're going to find a muscle that you can inject it into, so the muscle of the shoulder, muscle of the thigh, the muscle of the buttocks. You can go through clothing as well. If you are going to do it directly on skin, there are alcohol swabs that you can use. You put a 90-degree angle with the muscle, you push the needle in, and then you depress the plunger. These are retractable needles so that there's no sharp at the end of it, so the needle did not go into the orange or the grapefruit, it went into the needle. So that's not the end though. Again, now you need to evaluate. If the person is still not breathing after that injection, you need to start ventilating again with the face mask, and you do that for 3 to 5 minutes. And then you consider giving another dose of naloxone, and you keep alternating between breathing and naloxone basically until other help arrives or until the person is revived. And even when they are revived, we do want them still to interact with the first responders and go to hospital if they have been unconscious. Thank you.
Thank you. Well, now we'll have a round of questions from council. I know some of our guests are on a tight schedule, so if councillors can keep their questions succinct and answers too, that will help more people get through the queue. So Councillor Jang is first up.
Thank you very much, Mr. Chair. Question for Vancouver Coastal Health, first of all. I guess it's good news in the sense that we've leveled off the expected number of deaths.
Yes.
And Vancouver has been a city that's experimented and tried many different types of harm reduction, treatment options, whether it be the Naomi trials, what have you. Right. In your opinion, what has been the most successful piece in reducing the number of deaths of all the things we've done?
The immediate response was the distribution of naloxone. We haven't evaluated to see which component of our response has been most successful, but that's what we've really stepped up more than anything else. We don't have any more supervised injection services to date, except for the increased hours and insights. So it has been, you've heard from colleagues at Vancouver Fire Department, they've been leading provincially and starting to give naloxone. I didn't present data from the paramedics, who have responded to hundreds and hundreds of overdoses and given naloxone over this period of time to revive people. The peers who, even though we're only starting peer training, peers have been giving naloxone, our emergency department. So I think we would likely attribute the flattening out to that immediate response of getting the naloxone out there. So yes, good news that we flattened out the deaths, but I think it's a point well taken that hundreds of overdoses are occurring, and we need to address the reasons for those overdoses too.
Well, on that, I know certainly from my work at UBC that once naloxone is given, once they revive, often it causes another craving for drugs again, and so you're falling into this problem where people are reviving, but then they're craving illicit drugs again. So what are we doing in terms of treatment on demand? I think this is where it goes, because what's next? So we've saved the person's life, and how are we doing in terms of treatment on demand or treatment services in general? So once these guys are revived, we can somehow get them to treatment.
I outlined some of the new addiction services available. Dr. Ron Joe, one of our co-directors of addiction, has indicated that there is capacity among our addictions clinic and treating physicians in Vancouver. So we don't have waits. Anyone who wants to get detox, who wants to start on treatment, can start on treatment right now in Vancouver. So it's in getting those people access to it. It's linking them to the care. Not everybody's ready to start treatment. As you know, we have on-site a detox service right above Insight. When they come into the emergency department, there's an opportunity to link them to care. That will improve at the end of the year when we open the St. Paul's Hub that City Council has invested in. That will be an opportunity to take a little more time to try and link people to treatment. So the capacity is there. We just need to get people into those treatment programs.
So the issue is just getting people into the treatment?
That's right.
Okay. Thank you. I have another question for Chief McCarney. Thank you, Chief. So your firefighters have done a stellar job. I mean, looking at fire halls 1 and 2 and 5, I think they've done the most work on this. I'm a little concerned about the impact on our firefighters because this is not something they signed up for when they became firefighters to put out fires. Now they're doing a lot of paramedic work. I know that talking to members, there's issues with stress, PTSD, exposure to the chemicals themselves. How are we managing this? We really want to support our folks in the field.
Yes, thank you for that. Yes, we certainly are registering that it has taken a toll. In that particular location, that fire hall is one of the busiest in North America. It was averaging 650 runs per month. It's now up closer to over 1,000. We've taken steps to share that workload a little bit. So we are actively looking at ways to deal with that. One of the things we did institute was having our firefighters stationed in that fire hall for no longer than 18 months. We're revisiting that at the request of our safety committee to move that down to 12 months, and I think that's wise. And when it comes to the busy parts of the month, when the checks are delivered the Wednesday through that weekend, it gets very busy. Our firefighters are out constantly. We move other units towards there and share it. So we're trying to be as dynamic with this as possible. And there's more to learn, but I appreciate your comments, Councillor Jang. We have seen the mental health strain on our firefighters.
Okay, so you're doing everything. So we're working. It's great that you're working with the members to address this and other issues that we at City Hall can help you with. I think would be, in order as we address this emergency across our province.
Thanks, sir.
Thank you very much. Thank you, Mr. Chair.
Thanks, Councillor Jang. Mayor Robertson.
Thanks, Mr. Chair, and a big thanks to all of you who've spoken here today, and not only for the work that you've been doing to try and keep this crisis managed, but also the coordination and the work that you're committed to doing with each other, and appreciate your time being here at City Hall and helping us figure out what we can do as a city to support your efforts and ultimately the goal of reducing these overdose deaths dramatically is important. And even though we're comparable to last year, we've held the line. Last year was up dramatically over prior years. We're back up in that level of 12, 15 years ago when we had an overdose crisis on the streets that prompted the opening of the supervised injection site. So I just wanted to check in first on BC Ambulance Service and firefighters, the first responders who are dealing with people overdosing on the streets, administering naloxone. Appreciate Councillor Jang's comments, and to our chief, firefighters obviously are under a lot of stress, as are BC Ambulance Service. I'm curious the coordination between the two. Do we have stats from BC Ambulance Service, and do we have a sense? We know that between Vancouver firefighters and BC Ambulance Service that we're getting to the calls reliably, or what percentage of people dropping on the street do we not get to on time, firefighters or ambulance?
Mr. Mayor, I apologize. I don't have that answer for you. I'll certainly look at it. I can tell you that we are connected with the ambulance service through the BC Emergency Health Services with Dr. William Dick, and looking at this as well as our counterparts in Surrey, and where it is, as Dr. Daly spoke to, it's really it surpasses what we're experiencing here. So I'm not aware that I'm not aware of any incident where we have not met our response target for this category, which is emergency category.
Okay, and I know as there have been changes with BC Ambulance Service and the response times, I assume all of these overdose situations are the most urgent possible response from both firefighters and ambulance.
They are, so yeah, they're what's categorized as Delta Echo, so they are. And the one thing that we do have, I think we're somewhat fortunate in the city, is in the downtown east side, there is a large hub of ambulances. So, you know, the research that we've done on the work for our fire hall down in the Tewes district is they are very quickly, the ambulance does show up, and originally, when this occurred, the training to our firefighters to inject naloxone, there was, as you recall, there was some presentation by the ambulance service to our elected officials. But since that time, everybody that I'm aware of, the ambulance and the firefighters work very well on these calls.
Okay, that's good to know.
A little bit of data on the ambulance, which I didn't present. From April 14th to August 28th, they responded to 532 overdoses in Vancouver Coastal Health, most of them in Vancouver. 42% of those were in the downtown east side. We have not heard that there's any delay in response. The data also shows that most of the overdoses that they respond to and giving naloxone are out on the street, people on the street. Most people who die are in private residences, so that's part of the issue. We certainly want people, if they are going to be injecting opioid drugs or taking opioid drugs, that they do it in a supervised manner so that there's someone there who can respond. So good work by BC Ambulance in terms of responding, and also the fire department.
Yeah, Dr. Daly, maybe just a follow-up question on the on supervised injection sites.
Yes.
Obviously, harm reduction has proven an important way to manage overdose deaths, prevent overdose deaths, and manage a crisis for many years with IV drug users. I'm curious how quickly you think new sites can be up and running so that we're not having to respond to as many of these incidents on the street.
We will get our application into Health Canada next month. As you know, it's a fairly arduous process, and I know people are frustrated that it's taken this long, and we're all frustrated across BC at the length of time it takes to put together an application, because it requires us to come up with clinical plans for each site, criminal records checks going back 10 years for staff, site plans. Again, we have to do community engagement for every single site. The sites that I mentioned that are going to be, we're putting the applications in first, at the new mental health and addictions drop-in and Heatleap, require renovations to create the spot. They're going to have a number of booths that look a lot like Insight, so we have to renovate those to provide that, get the staff in place. We can't do it until we get approval from Health Canada. Health Canada has indicated a willingness to workshop their way through the application, because it can take many months after we submit it. We've waited months, even longer, to get approval, so we hope that it will go quicker. Therefore I can't give you a date when they'll be open. I'm hoping at the beginning of the year, and I realize that's frustrating for people. So in the interim, I think it's really important that we continue to do the peer training to give naloxone. If we can have members of VANDU or other peers who are trained and can go out onto the street and respond to overdoses when they see it. You don't need an exemption to respond to an overdose. You need it if someone's going to come in and they're going to bring their drugs in and give themselves the injection. We think that's a very good way of responding, and a number of other cities would like that option as well, because it's a lot quicker to get in place than a standalone supervised injection site, and you can do outreach to a lot more locations. So having peer injectors trained who are willing to go out and respond to overdoses where they occur, we think is the best interim strategy while we get these services up and going.
Okay.
Thanks, Mayor Robertson. Councillor Reimer.
Well, thank you to all of you both for the presentations, also the work that you're doing out there. Had a couple lines of inquiry, and I'm sort of trying to decide where to start. I think probably what stood out for me the most, I mean, there's the numbers that you showed us, Dr. Daly, by city, so those are the deaths. So you sort of then try and correlate that with the numbers we just heard on ambulance response, peer response, fire response. So, you know, you sort of have this picture that emerges that there's a problem everywhere. It's just being managed better and not resulting in death here, because the numbers of call-outs are astounding and don't reflect the number of overdoses that Insight or like that peers might be responding to. So if you look at that map, the fire map, this is a very correlated to income. It's not to say that because you're poor you're going to overdose, but when you look at where the overdoses are, they are the media stories are about, you know, kids who might go to a party and do drugs for the first time, and that's happening, but it's really like sheer volume is happening to people in desperate housing and other circumstances. So can you speak a bit to where we're at with the province. Like we know if we can't stabilize people's housing and get them access to other services they might need, like mental health supports, even if we can get a treatment bed, the chances of them being able to maintain sobriety is pretty low.
That's correct. And thank you for raising this, Councillor Reimer, because you're right. We're responding to an emergency in the same way we would if we started to get a lot of people suffering heart attacks. We train people to do CPR. That's like giving naloxone. That's the immediate response. We get good treatment in hospital, but you have to address the underlying causes of heart disease and address those. And if we're talking about the underlying causes of addiction, we are talking about those social determinants of health like poverty, like housing, like early childhood development. I've said here before in the past, early childhood development is the vaccine against mental illness and addictions. These are long-term strategies, but we need to start investing more in them now because this problem is not going to be solved. It's not going to go away. Fentanyl is not going to leave our streets, and we're going to have other drugs, other analogs we're going to see contaminating the drug supply. So we do need to not forget that most people who are dying, you're right, the media tends to focus on the young person who may not be an entrenched drug user who takes a drug, and you recall the cluster in Delta. That's not primarily who's dying. Certainly in our region, it is people who are living in poverty. It's people who are have suffered from addiction for long periods of time. So we do need to address some of those underlying issues because treatment, even if we had treatment beds, is a chronic relapsing condition. Having more beds is not going to solve the problem either. So I appreciate that. We, in Vancouver Coastal, we continue to identify early childhood development as our #1 strategy to address these social determinants. I would remind Council of that when I came to talk to you about the licensing for the marijuana retail outlets, I talked about the SASSY program in Vancouver schools, which is about teaching resiliency to young people so they make good choices. We would like to see more investment in programs like that. Early childhood development is at an even younger age. It starts when women are pregnant and providing support to poor, vulnerable young mothers for those first 2 years of life. It's been found to decrease the risk of mental illness and addictions later in life. But we also need to think about young people in schools and have those kinds of programs more widespread that prevent people from suffering from some of the issues that lead to addiction and mental illness.
Thank you for that advocacy and for the work you guys, that Coastal Health really has been a leading light on early childhood development. So the next sort of, yes, and there is this crisis that needs to be responded to. And it was a great demonstration by the doctor, but as noted, it's not just, it's not largely doctors that are doing this out on the street. So the street response seems to be working because you can see people, like you can do all the things that you just said about seeing them, asking them, trying to get a response and see where they're at. But a lot of this is happening in SROs. And what I'd be interested either from Karen Ward's perspective or Coastal Health's perspective, how we can get into those SROs. It's where the money would come from to do that and how we support peers and supporting other people.
To speak to the housing issue, as you kind of running parallel to this is the decline of the affordable housing stock in the downtown east side. So I mentioned housing specifically. We all know that there's hundreds upon hundreds of people living on the streets right now, sleeping rough and sleeping in tents all over the city. We've got about 100 people at 58 West Hastings, and I think empowering. First of all, we need to raise the shelter rates because you can't. When you look at the business case, you can't run a safe, healthy building at a rate of $375 a month, which is what the province provides for shelter. So we need advocacy to the province to actually have social assistance rates, somewhere close to what the reality is of the cost of living in Vancouver. So I think that through the peer support model that we espouse at Vandu, I think that what I'm seeing in the neighborhood is people are starting to learn about their rights as tenants and starting to work as peer advocates for each other within their own building. Getting people together to say, this needs to be fixed and we need this to work, and I don't feel safe because of these reasons. I think when you bring those residents together and get the support in place where people can actually learn from each other to do what's best for each other. I think that when you break down some of the isolation that can happen when you're living with mental illness or an addiction, there's a lot of isolation that can play hand in hand with that. There's the very visible people out on the street, but there's also many people who are alone in a very small and horrible room. And we always say don't use alone, but a lot of people are frankly alone, and we need to break down those barriers in whatever way we can. I always advocate for creative solutions as well as for technologically inspired ones that can allow people to reach each other in their time of need. So I think that supporting peer-based organizations is the way to go. Meet people where they're at is our philosophy, and you certainly need to build up. In order to create a situation where people can really start to look out for each other, you need to rebuild trust that's often been shattered by a really traumatic experience and indeed early childhood experience as well. I hope that helps.
We agree that we do need to work with peers on this, and we're trying to develop a model for a peer outreach team that would respond to overdoses, would provide harm reduction supplies, and would also collect discarded injection equipment. So we're working on that right now. But to your question, this is why we developed our pilot project with Lookout, what we call the Delegated Naloxone Project, where we trained the staff at I think 26 Lookout Emergency Aid Society shelters and housing facilities across Vancouver Coastal Health and Fraser Coastal Health to respond to opiate overdoses with naloxone, and we provided special delegated naloxone boxes for them to do that with more supplies, 10 vials of naloxone, things like that. We had a 3-month initial evaluation period, and during that time they responded to 150 approximately overdoses. So people in these environments, the staff there really are seeing a lot of overdoses, and they can really respond. And so based on the success of that project, we're now partnering with Atira and Rain City, and we're looking at expanding this. We're also using our data to figure out which are the SROs where people are dying, which are the ones where people are coming to the emergency room, and to try to get even into those private SROs, which is, of course, more difficult. The province is also, based on the success of this pilot, committed to create community naloxone response kits like our delegated naloxone kits that can be placed in housing facilities across the province, and then the staff can be trained.
Thank you. Councillor Carr?
Yes, thanks, Mr. Chair. First of all, may I just express my heartfelt thanks to all of you who are responding to this crisis, from the healthcare field, those people on the street in shelters, and Lookout, Vandu, our first responders. I mean, you're at the front line, and there are maybe as a flattening of the death rate as a consequence of that. And I really want to particularly thank Ms. Ward for, number one, noting the context, the stress around housing and situations like that, and for making it very clear that the death rate may be flattening, but the death rate is not the overdose rate. And the reason the death rate is flattening is because of the work that is happening out there, and it's very difficult. I also really appreciate the demonstration. I mean, as you walk through, Doctor, it was a grapefruit, right? But as you talked about, needing to put the mask on and do the breathing, and if there's no response, then it's a second time or a third time. When we're hearing this in the media, there's many times that sometimes this has to happen. I cannot help.
Or can you bring it to a question?
I am getting to a question. The stress. And so that's what I want to focus on in my in my questions, actually. And Chief McKerney, if they're really directed mostly at you, because of the situation with the number of calls that are increasing, and you said 600 or 650 to over 1,000 in Fire Hall 2. I've heard sometimes up to 30 calls in a shift, 14-hour shift, night shift. Yep. That's 2 an hour. So you talked about doing some or looking at some measures. I'm wondering if you're looking, I think the shifts are what, 2 10 hours and then 2 14 hours, so there's a 10-hour break. And if it's 14 hours and they're going constantly, right? Are you looking at potentially changing the shifts or arranging things somehow so there can be more of a break, so there's more downtime?
Yeah, well, it's a great question. We were looking at a dynamic deployment approach. What we have done to date on this, and we're analyzing, I was just talking to Chief Morrison, we need to really look at the effectiveness, is we've actually changed the response district for that fire hall. Because your firefighters now are deployed by GPS, it's the closest unit, that's one of the reasons call volumes went up. So we've changed the response district in that area by way of tricking the system to 30 kilometers an hour for a street. So it's shrunk it down, and it's increasing the use of less busy halls. So that's one option. The other things that we're working on there, we know the calls that hall gets, up to 32% of it, they're canceled at scene or canceled en route because of the ambulances there. So we're working behind the scenes with the ambulance service to get a technological fix to reduce, like that's waste, to reduce that sort of call volume and use that time for other productive work for our firefighters. We move other units into that area at busier times of the month, but we always give the responsibility and certainly the permissions to our senior staff to move less busy units around. One of the options we have is at certain times, periods of the day, especially the evenings on the Thursday, Friday, Saturday night, is to take a unit from a less busy hall and move it there and move the number 2 unit to get some downtime into that location.
Okay, I understand that. I just hope that you are also looking at potentially, different shift assignments in order to do that. But I do have a few other questions. I was concerned about the accidental exposure that was raised to our first responders. And I understand that in some places, first responders are given, I think it's an aerosol, and it would counteract, an Archon or something, it counteracts the possible accidental exposure. So are we looking at that for our first responders?
That I don't have an answer, Scotty. Oh.
Sorry, the VPD mentioned the intranasal naloxone, which
Right.
is recently licensed by Health Canada. That is what you're talking about.
Yes.
So they are, I don't know if they have it yet, but they're going to have it. And this is something that can be used if there was a first responder exposure. Having said that, this is not a problem that we're seeing by and large. So we don't want to give the impression that first responders are at tremendous risk because they respond or even appear to someone with an overdose at risk of suffering an overdose themselves. We're not seeing this occurring, but there is a concern and some anecdotal reports that perhaps about some low-level exposure. So the fact that the VPD will have access to the intranasal naloxone now is not just for use on citizens. It could be used if any of their police were exposed.
And the firefighters, I'm assuming.
Firefighters, I don't know if you've
Yeah, so I apologize for not having that right at the tips. So it's in the training, Councillor Carr, and of course the naloxone would be used on our firefighters if they showed symptoms of overdose.
Thanks
I
very
think I'm
much.
out of time, but I'll follow up with other
Councillor
questions.
Ball.
Thank you.
Thank you. Just 2 quick medical questions. There are a lot of medical problems with many people in the downtown east side that aren't just illegal drug use. And I do know from a lot of personal experience that diabetes and both up and down blood sugars can mimic everything that you've described here as an attack. So how do say peer people or anyone that is not necessarily a medical doctor identify that somebody actually has had illegal fentanyl so that this can be useful? And my second question, is there an issue with somebody who say has diabetes or not a drug issue being given either of these drugs? So if you could just let me know those 2 medical issues, I'd be appreciated.
Yeah, I mean, when somebody is not breathing, it's never a problem to give them ventilation. So to give them breaths, if somebody's not breathing, you need to breathe for them. So that's why that's part of the training. It's not only naloxone, and that's why we also have people call 911. And the kind of emergency response there is not the only thing. The first responders will come. So naloxone, though, is an antidote for opiate overdose. That's all it does. It reverses opiate overdose. It does not have other effects on the person. And so if someone was to receive naloxone and they weren't having an opiate overdose, it would just have no effect. And so that's why the training is to continue to be there and monitor and continue giving the breaths as you go. I mean, they should consider other medical problems too. If somebody has a medical alert bracelet that says diabetes, then they should, give them sugar as well.
So there is a normal person, were they to be given a naloxone or the other drug, for instance, our firefighters or anyone who do not have
it would have no effect on them.
No effect
unless
whatsoever.
They had, succumb to an overdose.
And that's been tested, and
Yes,
we know that?
Yeah.
Great.
Yeah, because this drug has been used for years and years in the hospital setting and by ambulance professionals. So we have lots of experience. It's a very safe drug.
So there is no issue for our firefighters or our police with inhaling it or having it available?
As we said, there is I guess what I would call a theoretical risk of that. I think the main setting where there's a risk of that is when they enter into drug labs, and so where there could be a lot of product around, but there are many risks to them when they enter a drug lab, and they need to protect themselves not just against fentanyl, but against other chemical risks and things like that. So that's why they wear personal protective equipment in those settings. When people are responding to overdoses on the street, there's really I would say no risk at that point, or very minimal risk, and the personal protective equipment that you should be using during that response, the mouth guard and the gloves, should protect you from those exposures.
Yes, thank you very much. Thank you.
Councillor Tichenova.
I have a few questions. First of all, it would be regarding, I suppose, the risk, or a question for Dr. Daly, just regarding a follow-up to Councillor Ball's question on first responders who would be exposed to this. Would the incidences, or I suppose the dangers, be similar to exposure currently to needles? That, I mean, would we be looking at sort of the same type of danger, where I understand if a first responder is exposed to that, a paramedic, police officer, firefighter, that, there would be a preventative cocktail or something they could take? Would this be the same sort of case? Would we see the same amount, would you say?
No.
Is there any data on that?
No, in fact, I've never had a single report in this crisis or earlier of a first responder, paramedic, firefighter, police who's been exposed to an illicit drug and suffered an overdose in the course of responding to an overdose. Not a single one. There may be first responders who are themselves suffering from addiction. We've had some of our own staff who are dying of overdoses, but I've never had a single report of this. There's been anecdotal reports, I know, of some very mild symptoms, but this is really almost a non-issue, as Dr. Lysyshyn has said. However, you're talking about the exposure to discarded needles of people who are injection drug users, and I know we didn't talk a lot about that, but there is a concern about needles on the streets. There is a very small risk if you suffer a needle stick from a discarded needle, that if the person who had used that needle was suffering from an infection like hepatitis B, hepatitis C, or HIV, a small theoretical risk that you could be exposed. And we do, for HIV, can give you medications to prevent infection. Having said that, the risk of acquiring infection from a discarded needle is infinitesimally small. There have been cases of HIV from needle stick injuries. There have been cases of hepatitis B and hepatitis C. Almost all of them have occurred in healthcare settings among healthcare providers where the needles are very fresh. So we do have very good programs in place for first responders, members of the public who suffer a needle stick injury, how we respond. They can be vaccinated against hepatitis B. They can go on anti-HIV drugs. And we're not seeing anyone suffering from those infections.
So just to summarize, would you say that the risks would be similar to that? As you said, they're very low.
I don't think the risk is similar, because there's no, if someone has a needle stick injury, they may need to go on medications, vaccinations. Okay. We are not seeing anyone who is suffering from, any first responder suffering from symptoms of an overdose from responding to an overdose, and there is no recommendation we make for how they might need to.
I meant the percentage of, I suppose, risk of exposure to the.
I would say the risk is smaller in responding to an overdose.
It's smaller. Okay. Another question I have is regarding, I just pulled it up. There was a CBC article that I read about a young woman in Surrey who had some issues and was actually in the media for another reason, and now she is addicted to fentanyl. So you had spoken about heroin that's tested and that you found fentanyl in a large amount of
90%.
90%?
Among those who tested their drugs at Insight, yeah.
90%. I was hoping you might be able to comment on fentanyl addiction. And
Yeah.
are you seeing a rise in that? Do you anticipate seeing a rise in that? Because we've talked about people who are avoiding fentanyl, but this article that I read on the weekend really sort of made me think that this also may be a crisis. And
It
it's
is,
something
and
that wasn't
people,
spoken about.
I should point out, we have to be a little bit careful. Some people may seek fentanyl, knowing that gives them a more powerful high. So Dr. Lecition will address that.
And sorry, just before you do, I understand there's a difference, as Councillor Ball said, between medical grade fentanyl and the fentanyl that's being delivered on the streets. So if you could elaborate.
Yeah, so I mean, there is legally manufactured fentanyl, and then there's illicitly manufactured fentanyl. What we're seeing on the street is illicitly manufactured fentanyl. We know at the beginning of this crisis, the majority of people who had fentanyl in their urine were not aware they were taking fentanyl. So people are largely taking, this is illicitly manufactured fentanyl, are largely taking this unknowingly or unintentionally. Now, as the crisis has gone on and the issue of fentanyl has been publicized, there are people who now are aware that the heroin supply has largely been replaced by fentanyl, and so as a result, they're actively seeking out fentanyl. Now, that addiction is not really different than the addiction to heroin or OxyContin or other opiates. That's a opioid addiction, and so it doesn't really change it that much.
I'm so sorry to cut you short. I also have one last question. I'm just going to try and sneak in, and whoever would...
Can I make one more point? Just the point is, even the people who are addicted to fentanyl and are trying to buy fentanyl on the street are not trying to buy an unknown drug like fentanyl or carfentanil or W18, and they're not trying to buy an unknown purity and dose.
I have 5 seconds, so I'm going to ask my question, and you can throw your answer in there too. A question I had was you, Dr. Daly, had mentioned that the paramedic data is not included here. I've heard from our Vancouver police today, as well as Vancouver Fire. I'm wondering if there's anyone here representing the ambulance service or the paramedics, and do they endorse this approach?
They're not here, but I can tell you that they certainly endorse this approach. The paramedics work for the PHSA. They're not part of Vancouver Coastal Health, and they're not part of the City of Vancouver, but certainly they are part of the response. The paramedics in Vancouver and around the province have been giving naloxone and treating overdoses for a long, long time, and they're an important part of response. They're sharing their data with us, so it's a good collaboration.
Thank you.
Thank you. Councillor Stevenson has a question.
More than one, actually. Dr. Daly, I guess to start with you. I was fortunate to be in Ireland this summer, and I don't know, this has been very educational for me. I know little about it other than what Dr. Jang informs me and so on. But when I was there, I heard about fentanyl more to do with marijuana, laced in marijuana. Do we have that problem here?
We have not found it in marijuana yet to date, have we? Yeah.
I mean, this has been a major concern from the media, and obviously the possibility of marijuana laced with fentanyl would be very concerning because it's used in a more widespread way, but there's been no police seizures of marijuana contaminated with fentanyl. There's been no case where the coroners believed that this was a marijuana user who died of fentanyl and had not been taking something else. So we really have not seen evidence that marijuana is contaminated with fentanyl.
How long does it take for someone to be revived after these injections? And I noticed that you said that possibly there'd be 1 or 2 or more of these.
Yeah, so it really depends. If the dose of naloxone is sufficient, people will be revived immediately. But if they've taken a lot of fentanyl, then you may need several doses. From the evaluation of the provincial take-home naloxone program, we know that 90% of overdoses respond to 2 or 3 doses of naloxone. So that's why there's 3 doses in the kit, and very few require 4 or 5. So currently we're happy with having 3 doses in there, but the instructions to continue breathing and continue evaluating and giving naloxone until first responders arrive is also because sometimes an overdose will not respond to naloxone because it's not caused by an opioid. You know, it's like we heard about, could it be a diabetic coma? Could it be other causes? And so, you know, you have to continue that care until help arrives. But, you know, sometimes somebody hasn't overdosed on an opiate.
So how much approximately does it cost for one dose?
Well, that kit that I showed you containing 3 vials costs about $15. So it's quite affordable.
Okay.
Having said that, I should say that naloxone is now an over-the-counter drug in British Columbia. You don't need a prescription to get it. So you can also purchase it at a pharmacy. Anyone can. It does cost more than $50, I think. So we would like to actually see the kits more widely spread because we don't think a lot of people are willing to spend the $50 at a pharmacy. But we're purchasing, or the province is purchasing those kits for $15.
So the nonprofits, how are you distributing to them, and are they having to pay for it?
No,
or are we...
no, they're not. We are giving out the kits, and I don't know if you talked about the new program that we'd like to get in place to provide them with more than just individual kits.
Yeah, I mean, the take-home naloxone kits are given through community agencies, through healthcare agencies, through all kinds of different agencies. They apply to be a take-home naloxone distribution kit. They submit the forms, and then the kits get delivered to them. So we have over 60 sites in Vancouver Coastal Health, and some of them are community sites, some of them are healthcare sites, some of them are at the jail, at prisons, at various different places. So there are all kinds of different sites, but that's for individuals. And then we also want to create these community response kits, or what we've been calling delegated naloxone kits, to go to facilities like shelters and recovery homes and treatment facilities, places where people are at risk of overdose.
Because what we don't want to see is that that site has maybe one kit available and it gets used and then except for another overdose. We've heard reports of this. So we want them to have enough if they're dealing with a particularly high-risk population and a particular SRO, let's say, that they'll have enough of it available.
Okay, and I don't want to sound alarmist, but one of the other things I heard talked about when I was overseas was that we haven't heard of fentanyl until fairly late in the day here, in the public at least, and that there are far more powerful ones that are just lurking in the background. And if that's true, how do we even begin to deal with that?
Well, I mean, we are dealing with those other compounds as well. It's all part of the same problem. The drug supply is contaminated with illicitly manufactured fentanyl and analogs and other compounds. We speak about fentanyl because it's the one that we're most able to detect and it's the most common one. But we know previously there's been outbreaks of 3-methylfentanyl, alpha-fentanyl, furanylfentanyl, carfentanyl. So these are all drugs that are chemically similar to fentanyl, and there's a mixture of them on the street. And we have varying abilities to detect some of these other ones. And even less ability to detect some of the rare compounds like the W8T compound and the other ones that have letters and numbers attached to them that I can't even remember. So this is all part of the same problem, and it's all a product that's unregulated and grossly contaminated, and that's what's killing people.
So this is why I get back, and I mentioned this last time I was here. We need to remember that if we want to stop people from dying, we need to look at quality control. It's like the debates you're seeing about marijuana in the literature. Once we've legalized it, we can have a quality control program. I would remind you of Crosstown Clinic, operated by Providence Healthcare, where very entrenched drug users who have failed other forms of drug treatment are given prescription heroin, which is now approved by Health Canada. They are taking heroin, but they know the dose. There's quality control. It's not contaminated with fentanyl. We need to look at programs like that. We need to figure out how to deliver them in a way that may be a little less expensive, a little less confined to just one clinic site, that we need to consider giving people drugs where there is some quality control in place of illicit drugs.
Thank you very much.
Thanks very much, and thanks. That's all our questions. Thanks to all our presenters today. I think you can count on this council for support for whatever help you need in this really desperate situation. So thanks again for coming, and I appreciate your presentation today. So with that complete, we're now ready to hear about youth homelessness and challenges for vulnerable youth. Presentation from Ms. Zach and Ms. Bond. So we have about 6 speakers on this, and I am anticipating that we will, as is our policy now, stop at noon for a bite to eat. So those who are waiting for items after this, we might start one, but it's hard to be sure.
Thank you very much, Mr. Chairman. Just wanted to make a couple of remarks, particularly because this report is so timely given the remarks that Dr. Daly made about the importance of urgent action to support risk at youth, and particularly the ones who are living in SROs.
Excuse me, Ms. Llewellyn Thomas. Could the members of the media keep it down over there while you pack it up, please? We're going to carry on with our business, so if everybody would just go as quietly as possible if you're leaving, or come in as quietly as possible, that would be great. Thank you very much.
Thank you, Mr. Chairman. I'll just carry on by saying that this presentation is going to be made jointly by community services staff in social policy as well as in housing. And I'm pleased to say that we're seeing better and better collaboration within our own department, and particularly with the Development Services Buildings and Licensing Group. And I just would like to point out that Ms. K. Krishna is here to support any comments that might come through this presentation on our inspections of SROs. So we're reporting back on the PAGE report, which was before you over a year ago. We were asked to report regularly on actions that the city has taken. So this report gives the progress that we've had in partnership with other levels of government and the particular city actions. And while this report is before you, we're also asking that Council endorse the Youth Matters Pledge of Support and the guiding principles of Youth Matters community accountability. And also, while we have you looking at a report, to approve a Homeless Action Week grant of $3,000, which should have come to you earlier and through an administrative mistake is now before you. So thank you very much. I'll turn it over to, I'm not sure who's starting, Mary Claire.
Thank you very much. Mary Claire Zach, Managing Director, Social Policy. We're pleased to be here today to report back on the city efforts in collaboration with other partners on Paige's story. As many of you realize, Paige was a young Aboriginal woman of about 19 years age when she died of a drug overdose in Vancouver's downtown east side. And the representative's report documents Paige's life as a downward spiral of a child who never received the care that she needed and she deserved. Well, she died of an overdose. This was a result of years of abuse and ineffectiveness of systems that were meant to protect children like her. During her short life, Paige changed schools 16 times. Between 2009 and 14, she moved 50 times from foster homes to SROs, to shelters, to couch surfing, and was involved in more than 40 police files. So I'm providing that information just as some context and some backdrop to today's presentation. What I want to do just before getting into what the city's actions have been, we're also going to talk about what other things that the city has been supporting, both in the social policy area as well as the housing area. I just want to mention that in terms of our speakers today, we have Mark Gifford from the Vancouver Foundation, whose efforts that city has also been supporting, and they have come out with a report on the economic analysis of supporting youth exiting care and how important, how critical this is. And this is a very large part of this story and what we need to do to rectify it. In addition, we have community members who are going to be talking about community-led responses in terms of collective action and collective impact. So as far as Paige's story goes, the representative's report identified some key messages. One was urgent action across government and community to address these gaps, that no youth in care ought to live in SROs in the downtown east side. There was concern about compliance around duty to report. And throughout her report, she acknowledges the impacts of intergenerational trauma and the impact of residential schools on Aboriginal children and families. So the city is named in 5 of the 30 actions in the Paige report. We have a lead role in 2 of these. One is to coordinate regular inspections of SROs to ensure compliance and to provide training to our staff on their duty to report. We're also involved in 3 actions led by the province, and I should note that Sheila Robinson, who's the recently appointed Regional Executive Director for Ministry of Children and Families in Vancouver, is here today to respond to questions. These 3 actions included conducting an urgent review of services, analyzing numbers, and creating an implementation and action plan. In terms of youth homelessness and what are those contributing factors to youth at risk, we know that lack of affordable and accessible housing, poverty, improper discharge from institutions, mental health or addiction issues, many of the things that Dr. Patty Daly mentioned in the presentation prior to. In terms of family breakdown, this is an important topic, one that Mark Gifford will also be raising, is that 45% of youth aging out of care indicated that they were homeless at some point. So there's a strong correlation between aging out of care and homelessness. The whole idea around young people needing supports throughout their life from 0 through to 25, and that's what we've identified in our Healthy City strategy as well, is really, really critical. We know, for example, that only up to 20% of foster youth live with their foster parents or relatives after they age out, age 20 to 24, but children by comparison, 60% of other 20 to 24-year-olds live with their parents at home. So there's a real difference here. We also know that Aboriginal youth are really overrepresented in child welfare, homelessness, and other social determinants of health. And that through both the Healthy City strategy as well as our commitment to the Truth and Reconciliation Commission, that the city staff are really working hard to work with our partners around these issues. This slide just demonstrates the support to address issues around children at risk, whether they're through our social grants, the VPD and their efforts, our park board, and even through our public library and our teen librarians and the amount of annualized funding that's provided. I'm going to identify 3 projects that the city supports and ongoing programs that really do outreach and support youth that are aging out of care. One is through Aunt Leah's. So council approves just over $35,000 annually. That really helps young people link to supports to find and maintain housing, and also provides even young mothers with those postnatal and wraparound supports to really support young mothers and to work to keep those families together. LUMA in particular provides supports to Aboriginal youth who are aging out of care, and through mentorship is one of their big initiatives that they have. And you're going to hear through both the community presentations as well as from the Vancouver Foundation how important relationship is to young people, to all of us, but in particular these young people. Also here we have skills on how to rent and also life skills. In terms of prevention, the city is also supporting through a social grant the Aboriginal Mother Centre. It supports Aboriginal mothers and their children, providing an overall holistic approach to wellness, building cultural connections, etc. And the city also supports a child care that's built in conjunction with that site. So these are some services that we provide, and what you're going to be hearing from community is the real importance of connecting those services in community where young people live, where their families are, and where those supports and networks are, and how important those are to them. So I'll have Celine carry on and talk about the homeless youth population.
Good morning, Mr. Chair. Celine Mobles. I'm a senior planner with our housing policy and projects team. And I just want to talk a little bit about some of the work that we're doing. We did a homeless count last March, and we know that it is an undercount. It's a 24-hour point-in-time count, and often we have difficulty enumerating the hidden homeless. Youth very often fall into this category. That said, we did identify 171 youth under the age of 25. That accounts for about 15% of the homeless population. Of the 175 individuals, 32 accompanied children were counted at our shelters and NFA sites, such as safe houses. The majority of homeless youth, 71%, were sheltered, which is positive. Half reported having a mental health condition and 56 reported an addiction. Compared to the adult population, a youth was more likely to identify as a woman, as Aboriginal, have no income, report a mental health condition, and identify as LGBTQ2+. There are currently 54 youth shelter beds and 71 safe houses for youth in Vancouver, but more options are necessary for youth to exit homelessness across the housing continuum. The city, in partnership with BC Housing, Street to Home, and Vancouver Coastal Health, have opened 4 supportive housing buildings with roughly 500 units to provide integrated housing and supports to those who are homeless and at risk of homeless. The Rain City and Atira building that you see here are targeted to women and women-led families so that if there's a family breakdown, the mom is able to maintain the tenancy and ensure that the housing remains stable. The other 2 projects listed here include units targeted specifically to youth, and each site also has a dedicated youth hub at grade. Since 2008, the city has partnered with the province to open additional low-barrier temporary winter shelter beds to ensure that people can come inside during the coldest, wettest months of the year. Last year, we opened 210 beds, including 10 dedicated beds at Direction that were targeted specifically to youth. This year, the city has developed a draft 3-year strategy to meet the housing and shelter needs of the street homeless and to support our tenant relocation obligations. The draft strategy has been presented to the provincial government, both BC Housing and Vancouver Coastal Health, for input and feedback. And I just want to add that the province's recent announcement of a $500 million plan to create 2,900 new rental units is welcome news. I think the draft strategy that we've developed and the conversations we're having with the province position us to engage with them around opportunities with this latest announcement. I'd like to also turn to our work on SROs. SROs are often the last resort before homelessness, and we know that the private stock is at risk. Rents are increasing. Since 2007, there has been a 43% decrease in private SROs renting at welfare, and we've seen a 27% increase in private SROs renting at $451 or more. In response to some of the concerns that we're hearing around conditions, livability, and affordability, we're reconvening an SRO task force that will bring together tenants, owners, nonprofit operators, advocates, and others to develop next steps in our ongoing SRO strategy. And we will look to tools used in other cities and find ways to build on our existing policies and regulations. The outcomes of the task force will feed into our housing reset that we expect to bring back later to council later this year. And this slide just shows the makeup of the task force. It will be co-chaired by the city and will include a diverse range of individuals and organizations, and we'll be looking for their input and guidance as we develop recommendations to bring back to council. And before I turn it back to Mary Claire, I'd just like to point out the proposed timeline for the task force. It's an aggressive one. We'll be convening our first meeting shortly, and then we'll organize a number of workshops and working groups necessary to advance key aspects of the work before reporting back later this year.
Thanks, Celine. I'll just provide an action summary. And so in terms of the city's response to Paige's story, is that there's the 2 items that we had responsibility for. So city inspectors are trained to look for youth occupying SRO rooms and report to social workers and police. This is an ongoing effort, and staff conduct cross-departmental annual SRO inspections, and training will be refreshed for inspectors annually and through the SRO task force. Secondly, the Ministry of Children and Family Development has facilitated duty to report sessions with city staff. Some of these have been completed and some of them are ongoing and others are in progress, as you can see above. The city is also participating in the rapid response review, as well as is Parks, as well as VPD staff. And I should note that Howard Tran is with us from VPD and a really important partner with the city and our provincial partners on many, many things. So the new items related to Paige's story that we are recommending is first to endorse the Youth Matters Pledge and principles that support place-based collective impact happening in community and neighborhood. We really see that this aligns really well with our Healthy City strategy, that through the plan we identified the need to try to do things differently, and to do so we need to transform systems that give rise to our existing social, economic, and environmental challenges. I really stress that the health and well-being of Vancouver is everybody's business across public, private, and civil sectors, and including all of our residents. And we really feel that the pledge really speaks to that vision. Secondly is to continue to work with partners to secure our commitment to the draft 3-year shelter and housing investment strategy. And thirdly, Council approved in camera yesterday support for a child, youth, and family innovation hub that involves the co-location of two nonprofits, Pacific Community Resource Society, as well as West Coast Family Center, that provide a lot of support to at-risk families and youth, as well as the Ministry and Child and Family Development to be co-located there. This will require reporting back to council pending lease negotiations and pending some project planning, but we're really pleased to also show that as a demonstration of our partnership with community and with the provincial government. So the provincial response to Paige's story also includes, as I mentioned, the rapid response team, but they've also are contributing towards new positions, to create an adolescent services unit located just outside the downtown east side. They've planned to contribute over $400,000 in additional funding for youth outreach, which is also identified through the Paige report. They have a plan to open a low barrier housing through 1 5 new bed establishment for low barrier temporary housing for young people. There's a strong need for. As I mentioned, conducting a review of all of their files and safety plans has been completed, and they're developing an action plan. Thank you, and staff are available for questions, as is our representatives from the ministry. Thank you.
Thanks very much. Are you holdover from the last debate, Councillor Stevenson? Do you have questions for staff? You do? Okay. So we have about an hour to lunch, so it'd be great if we can hear from our speakers before then. If not, then they'll have to come back afterwards. But carry on. You got questions for staff? You want to go there? Okay, sorry about that.
Thanks very much for the report. One area that I'm particularly concerned about, just having dealt with this for a number of years, and that's slum landlords and the problem of slum landlords and the problem of living in these conditions and SROs and so on, because obviously these are very vulnerable youth, and as you mentioned, Aboriginal, LGBTQ plus women and so on, and it's pretty tough to stand up against some of these people who are manipulative, to say the least. So I'm wondering what we're doing particularly in that regard to deal with them, and have we been looking into them to a large extent, and how are they being helped?
It's probably best for my housing colleagues to speak to the SRO task force and other initiatives. Okay.
Thank you. Yes, that is an ongoing concern. It's something that we addressed a lot through the first round of the task force. We did a lot of workshops with tenants actually on rights and responsibilities under the Residential Tenancy Act, what they could do if they had a problem either with their landlord or a condition in their building, who to call, what to do. So we've done a lot of that work. I know that Karen spoke previously. There's a lot of work in the community as well about educating other tenants on rights and responsibilities. The task force that's coming up, I think that'll be a key issue: livability, condition, safety and security, in particular for women and other vulnerable populations, is something that we'll be looking to address. We've also provided some grants to increase services for folks that need some assistance. We've provided a grant to First United to do tenant assistance through the residential tenancy process, as well as partnered with the Residential Tenancy Branch to open an office at 390 Main Street so people have access to those services. Obviously, in terms of conditions of buildings, our ongoing inspections and enforcement of bylaws and the work of our coordinated enforcement team is very important and ongoing. But I think a lot of these issues, that they're consistent, and the work of the task force will see how we can evolve and work out the next steps of that strategy.
And what about helping to get this particular group of people out of those and into other kinds of housing?
In terms of youth, I mean, I guess, yeah, sure.
Well, obviously, we've referenced the duty to report in the report and in the discussion so far. So the expansion of training for our staff and other, first responders in the community, if they come across young people who shouldn't be living in SROs, then they have a duty to report that to the provincial government. And we're working with the province and talking to them about the needs for more housing and more shelter spaces, so that when that duty to report comes to their attention, that there is somewhere for people to go. And we've indicated in this report that there's some new investment coming from the province around these 5 new low barrier housing spaces, but we know that that's not enough and that we need to see more investment in both new housing for young people and also new shelter spaces.
Thanks.
Thanks, Councillor Stevenson. So we'll hear now from our speakers. First was Mark Gifford. Welcome. Okay, raise that podium. There's a button down on the right-hand side.
Wow. We'll drop it momentarily. So thanks for having us this morning. Great to have an opportunity to be back and speak to you a little bit about our work. My name is Mark Gifford. I work at Vancouver Foundation as the Director of Grants and Community Initiatives, and I'm here with Ashley Crossan and my colleague Trilby Smith to speak to you today a little bit about the Right, the Future, and Fostering Change work and the report we released on Monday. So I'm going to turn to Ashley.
Hi, everybody. I'm really excited to be here. So many of you know what Fostering Change is, but I'll remind you. So Fostering Change is a strategic initiative at Vancouver Foundation that really wants to ensure that young people who age out of foster care have the same opportunities and can succeed like their non-counterparts who aren't in foster care. A couple of things. I wanted to thank you for your endorsement of the Right the Future campaign. I'm really excited to tell you that we have 17,000 signatures, which is really exciting. I wanted to remind you of your motion in June. Well, that's actually next week, to endorse the campaign at the Union of BC Municipalities. I wanted to let you know that the City of New West has also endorsed the work and is really committed to supporting the motion at UBCM as well. Yeah. Yeah. Off to you, Mark.
And a reminder, here's the petition. We've got some gifts because you guys are always short on materials to read. So there are packages here for council that provide a little bit of that information. So on Monday, we released a report, Opportunities in Transition, an economic analysis of investing in youth aging out of foster care. This was by Marvin Schaefer of SFU, Linnell Anderson, and Allison Nelson. The copies in that package of the summary report, and we have the lengthier versions if you are really excited about digging in on it. One of the great things about this report is the level of community engagement in the work. We had cross-government and cross-community involvement in the development of it, which I think speaks to some of its strengths. It's actually 3 reports. The first looks at the outcomes experienced by young people aging out of care. The second report looks at the cost of those adverse outcomes, and the third is what might a support package look like, and what benefits might it create. Quickly, on the summary of the recommendations, really building on what exists, the limited infrastructure that we've got right now, but longer, more flexible agreement with young adult support for existing service organization, and some of the continuation and extension of the fee waiver supports being provided currently. The report found that a cost of a basic package over 6 to take young people to 25 is about $13.75 per month. which is the equivalent of about $99,000 over that 6-year period. It represents about a $57 million incremental cost for the provincial government per cohort aging out each year, basically a rounding error. The cost recovery, closing less than 40% of the education gap that exists for young people aging out of care, would generate benefits equal or superior to the cost. And even if there was zero benefit from this level of investment, the cost to British Columbians would be about $33 a household per year, or $275 a month. That's if there was no benefit, which is highly unlikely. So in summary, it costs up to $268 million a year associated with young people aging out of care. That not $57 a year, it's $57 million a year would improve those outcomes, which makes for a really clear economic case for improved supports. And as said, it's really an economic case that just adds another level of argument to the moral and social argument that that already exists and already enjoys large-scale public support for these kinds of resources to be available to young people. And in Vancouver, you know, it's really speaks to your efforts at Council to provide some leadership around creating an affordable, inclusive, and connected city for all young people, and really appreciate the leadership that Council has taken to date. Thank you.
Thanks, Mr. Gifford. I don't see any questions, but thank you very much for coming, and thanks for to your co-presenter as well. Our next speaker is Scott Clark from the Our Place Society. Welcome, Scott.
Thanks. Good morning. I'm Scott Clark. I'm one of the coordinators of Our Place, and we've been working pretty hard over the last 9 years trying to develop a more resident-based, friendly, strategic approach on how we support vulnerable children and families. Mainly started in Raycam community. I got a PowerPoint here. Oh, yeah, right. There we go. I don't know how to operate it. Where's Judy? She said she was going to help me. How does it work? Judy, sure, if you could do that. I've got a PowerPoint that we've provided for you. I'm not going to go through the whole PowerPoint because I think I've only got 5 minutes, but the first, if we could just take me through the first one, and I've got a newsletter I want to share with you because it gives you a little bit more information. I don't know who I give that to. And that'll give you we're working it now, right? Okay, there we go. I'll give you a nice sort of brief overview of our last report out to the community. The key thing around a collective impact place-based response is it's really resident-based on how we work with the local residents through an inclusionary lens, a child youth-centered, with accountability back to the child, something that's responsive and it builds the relationships. It obviously needs to be timely and consistent. And we're really looking at how we integrate various systems from federal, provincial, First Nations, foundations, and municipal levels of government, integrating and coordinating those services to really build on the strengths of vulnerable children and families. Some of the items we've identified since we had 2012, January, we started to hear about some very bad things happening in Grandview Woodlands, harming our vulnerable children and families in the area, was that the 9-to-5 service model does not work for vulnerable children and families. We need services when they need services. Confidentiality concerns between different agencies so that we can share that information to ensure that when the child or the youth is moving through the system, that everybody knows who's doing what with that child, and there's accountability back to the child and the family and the community. We identified safe houses, particularly for young people under the age of 16. Far too many of our young people that are ending up in the emergency department don't have a place to go, and I think those stories have been well documented in the RCY reports. we know that there's been a number of barriers in communities, in the actual physical place of a community, a number of barriers preventing vulnerable children and families from accessing programs and services, be it through the community centers and schools, in fact. Some of the costs, we've identified those barriers and we're addressing those barriers through part of the other strategic approaches of our place. And we firmly need to start recognizing that no one program by any level of government is going to be able to deal with the intergenerational impacts of oppression, residential schools, poverty, and so forth. And so we're really taking a macro perspective, a lens on the work we're doing, and a lot of that is around people, the place, and policies, realigning those three with the neighborhood and its residents. Thank you, Judy. Some of the key issues we've identified through numerous community forums with the residents in the community are exclusion. I think there's been enough reports on that about exclusion just for Vancouver rates as a whole, but particularly for marginal populations, it's just that much greater. As a result of exclusionary practices, we have identified risk barriers, drinking, alcohol, drugs, self-harm, crime, the whole array that we're well aware of. Some of the immediate solutions are outreach and management, establishing and building relations. When we first learned of the suicide pact in 2012 in Grandview Woodlands, we immediately organized a Youth Matters emergency meeting and bringing together organizations to figure out what we could do, what is and what we could do to support those young people. So we identified that there were key issues that we need to deal with. Moving to the next part, Judy. The long-term solutions was what we're really looking at is building a process that's going to bring community accountability back to the residents, back to the young people, back to the families, ensuring that we're measuring our work, it's evidence-based, and we're filling voids that are currently existing in the communities that we're working in. All of this stuff is going into the circle you can see at the front is the integration of community connections, getting our young people fully engaged in all the transitions from prenatal all the way through to university, college graduation. So we have a fantastic team that are working on that right now. That's what our goal is. Our goal is to close the gap, build inclusionary, engaging communities. Here, if you look at that, we're talking about a paradigm shift. We've seen the federal government, the provincial government, the civic, and the
Mr.
parks.
Clark, you're a bit over time, so you should start to wind up.
Have endorsed the Truth and Reconciliation recommendations, and that's what it really requires is a paradigm shift, a culture shift, and it's about looking. If you look at that diagram at the top, you'll see, going back, Judy, and I'll stop at this one here. If you take me back, you'll see the four ends. Youth at risk on the left, a community, a physical community. The bottom part is all the agencies, and then the top part is informed regional directors like MCFD, City of Vancouver, and so forth. Those relationships are nowhere near as tight as they need to be, and so what we've developed is a community accountability partnership agreement, and with that, we're linking in all those services, those 6 interrelationships to build a strong, seamless delivery from prenatal all the way to elders care, and we're seeking your endorsement and your support to sign our pledge. Thank you very much.
Thanks. Great presentation and no questions, but oh, there you are. Okay. Councillor Genova has.
Try and be brief. Thank you very much. I actually had the opportunity to come down for the United Way announcement for the, and correct me if I'm wrong, but that was a fairly substantial donation or contribution from United Way to our place. And I'm just wondering if you might be able to, I know you had talked about the importance, but in moving forward with your funding model and being able to provide the services that you do, is this something that you sort of revisit annually, or is this something that you're always sort of fundraising for? What I understand your need is much bigger than what you currently, all of the people that you could provide that need your services.
Yes, that was the Lower Mainland United Way. That was the press conference and the announcement. The United Way is provided, United Way supports collective impact place-based approaches, and they're supporting a particular age cohort of the populations that we're working with. The much bigger issues that we're working on is that this model that we've got here is actually based on the United States Promising Neighborhoods model, where they're funding 61 of these neighborhoods in the United States, probably in a year or 7-ish. And so we're seeking partnerships with various funders to get Promising Neighborhood-like funding to fully adopt this model in Vancouver's inner city. So it's an ongoing struggle, but the passion and the commitment behind the people that are doing this work is immeasurable, and it's growing, and we're showing success, which I can't get into, but we have other people here from our team who will be reporting out on some of that work as well.
Thank you very much.
Thank you. Thanks, Mr. Clark. Our next speaker is Eva Moore.
And I'm going to be speaking with Amanda Polcino as well here.
Okay.
So thank you so much for having me today. I'm Dr. Eva Moore. I'm an adolescent medicine pediatrician at BC Children's Hospital. And I work full-time at the hospital and in the community. I do eating disorders, I do youth health consultation, patient and outpatient. And part of the job that I'm very passionate about, I'm here to talk to you about today, is my social pediatrics work. And this is a working group that within that, part of this is a working group that I've had with my community partners. And so we wanted to share with you some of the stuff we've been working on. And just to frame it, this group did come together before PAGE, but there are stories of young people really struggling in the systems that are ongoing. So for example, we've looked at a couple cases and really tried to problem solve what's happening for these teenagers. So for example, a young person, very well liked in the community, generally does really well, a good sense of humor, and yet from a very complex social situation. And those social situations are changing dynamically. Things are getting kind of tough for this kid. He goes drinking with a friend, becomes suicidal, and the community center who's there intervenes, calls 911. That kid's brought to the emergency department. And when it comes to emergency department, it's not his first time here for that issue. It's actually his third time this summer that he's been there. And now what does the emergency department do? By the time he is there, he may have sobered up a little bit. He's no longer suicidal. He just wants to go home. But as doctors, we can't locate a parent or a responsible adult to take care of this child. He's generally an independent child. And he feels like he's ready to go home, but we don't know what to do. So how do we plan for a safe discharge and follow-up? And this is something that we struggle with in the hospital, but the community struggles with as well around kids like this. So vulnerable youth are presenting unaccompanied by adults to the emergency department. This is an issue we see at Children's Hospital, but it's an issue at hospitals around in the region. Kids are using various different hospitals. And there's a lot of challenges to working together, both within and outside of the hospital situation. So first, let me tell you about Richer. This is the Social Pediatrics Initiative out of Children's Hospital, and Richer stands for Responsive, Intersectoral, Interdisciplinary, Child, Community, Health, Education, Research. It's basically to demonstrate that we're working in collaboration with our community partners, and we're responsive to these issues, so that we're a dynamic group and trying to change how we deliver care so that it's best reaching the people at need, who need it, and falling through the cracks. But there are a lot of challenges of working across sectors. So for example, in the emergency department, we know medicine quite well, but we have limited capacity and expertise in understanding the child protection systems in the community, understanding how community centers works, and other people that are working with these same youth on a day-to-day basis. There's also that alphabet soup problem. What does ED mean? Does it mean emergency department? Does it mean executive director? How do we actually communicate among professions, and how do we establish these lines of communication in and out of the hospital? There's confidentiality to concerns. You know, the youth worker may be the best person to know this youth, but as a physician, am I allowed to call them up and tell that health information to a youth worker? It might actually be the most relevant person to help carry out some of those recommendations. And then just our language, our cultures, our timelines are really different. So I've been really happy to be part of this working group. I've just been amazed at how many people are committed to come to the table to try to address some of these situations. So from Children's Hospital, we've had very lucky to have the medical director of the emergency department attending meetings, the head of child protection, and representatives from mental health, social work, Richard program, adolescent medicine, and then Ministry of Children and Family Development, VACFAS, Parks Recreation, youth workers from RACAM, NICES, Vancouver Coastal Health, and Child and Youth Mental Health. And so some of our outcomes so far is really just built on this communication, so tools of how do we actually talk to, across these disciplines. So for the hospital side of things, we needed to be educated around Section 13 and what are the child protection concerns for teenagers. How do we access help when we have a teenager that we think might need protection, and how do we make that call? So we actually asked child protection to give us a script as to, what do we actually say? And then when things aren't working, we have a quality assurance tracking method in place. I'm going to hand this over to Amanda now to kind of talk about the community side of things, because now we're working on the communication from community to hospital and how that can work.
Wonderful. So my name is Amanda Palestino. I am the Director of Community Programs for the Network of Inner City Community Services Society. And I've had the privilege to be part of the working group for the last, 18 months or so. I'm going to start with just another sort of anecdotal case, just to demonstrate, I think, some of where we came to where we are now. You have a female youth, she's 16 years old. She ends up in the BC Children's Emergency Department for intoxication and suicidality, which is something we see a lot with our young people. It's the first time she's in the emerge department. And as the ED staff tries to perform an assessment, the youth is not overly cooperative. She has FASD and some cognitive delays. So after hours, staff calls after hours. There's no real open file. They have this young woman living with her mom, but the phone number is disconnected. So the staff needs to come up with a discharge plan at some point in time. So they start to press this young woman to find out some information about her mother and her living situation. And this triggers her. She becomes really combative, and she's viewed as a danger to herself and to others and ends up in the psych ward. What the emergency department doesn't know, and that the community does know, is this young woman has a turbulent relationship with her mother. Her mother suffers from a number of challenges in life. And as the community knows that, they've established a safety plan with this young woman so that when she has a rough patch with her mom, she can call her auntie, and her auntie will come and get her, and she can stay there. But in this particular case, that emergency staff didn't have that information, and this young woman ended up in the psych department. And so when she was released, she was not willing to participate in any sort of the follow-up care in those pieces. So through this working group, what we figured out through confidential case reviews is that something as simple as a phone call from a community worker after sending a young person in fundamentally shifted that young person's journey. Because the community workers have something that's like called, the emergency department refers it to as community collateral. So this led to the development of the shared tool, which is basically a way to get to ensure that vulnerable community collateral, like vulnerable youth information in the community collateral, gets to the emergency department physician so they can make decisions. It's based on something called the SBARD tool, which is a commonly used tool within the hospitals and the medical sector to bridge communication and communication, and it's like a closed loop of communication. It follows the physician's assessment. So it is something that when you go through this script and you're providing information within this format, emergency staff automatically recognizes as something that, that they're used to, and it's that bridging those gaps in communication. So this is a pilot. We launched it, I believe, in April. We still have a lot of work to do because we're working with changing behavior. We have to remind young people, like the youth workers within the community, to call the emergency department. So we do still have a lot of work to do. When I look at this working group from where we were and where we are now, it was deemed from youth workers' perspective, working at the emergency department was one of the most frustrating parts of their job. It was this safe place that young people would go to, but also there was this, it would almost like a wall would go down, the communication would stop, so you'd send them in, and then youth workers would turn around, and 3 hours later that young person is back in the community, and they don't know what the discharge plan is, they don't have any sort of communication back and forth. Which is a very frustrating experience and left people feeling sort of unheard. And there was no information for those youth workers who really have valuable information to get that to the emergency department. And then the emergency department is making decisions without having enough information. And where we are now, I think one of the biggest pieces is that we all had the same goals and purposes, but we didn't necessarily have a clear understanding of roles and limitations. And so trust over a year or so has created the opportunity for really candid conversations where we could dispel miscommunications and misconceptions, get a clear understanding of expectations and also professional limitations. And through that, we found that there's a stronger continuum of care for these young people because our youth workers know that when they send a young person into the emergency department, there is a communication back and forth, and that's a really big piece. And so they're more willing to encourage young people to be more open because they know that those support pieces are there. We also have a really clear understanding of the gaps for vulnerable youth when accessing emergency departments. For example, BC Children's Hospital has no full-time social worker. If you look at the standards for all the adult hospitals, they have 24-hour social work. BC Children's doesn't. So when you're looking at those communications, it's crazy. Another thing, obviously, housing is a huge piece as well. So with regards to just some next steps,
yeah, try to wind up.
We're done. Yeah. So we do have to work on information sharing across institutions. Youth are presenting at different organizations, so we need different hospitals. We need to get this tool out and to the different hospitals because right now BC Children's works with us, not everybody else. And we are looking at doing some in-depth evaluation over the coming years. Thank you very much for your time.
Thank you. Timing was actually pretty good, and it's a very encouraging report, so thanks. We don't have any questions. Jess Boone.
Hello, this is my first time at council, so thank you very much for having me. My name is Jess Boone. I'm 26 years old. I am a youth worker at Raycam. I'm a third-year UBC student, and I'm a former youth in care. So I'm going to tell you a little bit my role. I am a youth worker at Raycam, and I was brought onto the team to facilitate an advisory council for the Youth Matters Forum. So what I do is I meet with youth in the East Vancouver community. We come together. I document their concerns. I build relationships with them. I help them build capacity in learning about the different institutions that affect them and help them with supportive work and build advocacy pieces that we then bring forward to the Youth Matters forums. This sounds very, very lovely, but in reality, it can be a little bit daunting at sometimes because I meet youth who are experiencing a lot of struggles in Vancouver. So things surrounding affordable housing. Many people who are on my council are former youth in care. They're youth who are First Nations or the LGBTQ community. All of the members on my council are struggling with affordable housing in the city. Many of these youth who are aging out of care from 19 to 24 are often struggling with supports around mental health, struggling with stuff around housing, getting into universities and getting onto these programs. A lot of these youth have been affected by the fentanyl crisis, either having friends or friends of friends either pass away during the crisis. So welcoming these young people into community and trying to build capacity has been fantastic, but it's been a struggle. But these youth definitely want to be there. A lot of them are very happy to be a part of the Youth Matters forum and to be welcomed into that community. So my ultimate goal is to just keep on building relationships and to keep on learning and to share this information about the work that's being done in East Vancouver. So, yeah. That's all I really have.
And I'm Judy McGuire with the Inner City Safety Society, and Jess and I agreed to split this time. We're an active partner in Youth Matters and in the Our Place strategy. And on behalf of everybody, we want to really thank and acknowledge all the work that the city is doing, that social policy is doing, that housing is doing, our partners at MCFD. We work with the Vancouver Police. We are working very closely on a number of different strategies, the Vancouver School Board, the Vancouver Parks Board. We really believe that taking a strategic approach and working not just with the youth when they in fact are falling off the cliff, but as was noted before, noted when you talked about the fentanyl crisis, it is so important to get them early. It's so important to support the family. It is so important to strategically look at all of the pieces. If you look at Paige's case, for example, there were so many times when the right intervention at the right time earlier on would have made a substantial difference to that young woman, including the fact that even if her aunt had been able to get extra money to house her in a second bedroom, that in fact might have kept her off the street and might have prevented what in fact finally happened to this young woman. So we say, you know, that it's not enough just to sort of do the Band-Aid approach. Yes, you need the Band-Aid. Yes, you need the short term, but you need the long term. So we have a graduation strategy. We're looking at getting every child in the inner city graduating from high school, every single one. We've already working with Richard, working with our partners at BC Children's and Families. We've seen that we've had fewer and fewer children, more children ready for school when they get to school, because we do everything from hearing tests to assessments. We get them into preschool. We make sure that the mothers are supported. We're working with mothers and families to get them back to work. Once the kids are in school, we're working with the city now on a project we called Inner City Connect to in fact get as many kids as possible connected to the internet, because we want them to have 21st century tools. We need to get them computers. And again, the city is a partner in help making that happen through Reboot Vancouver. So we have a number of different strategies. What we're asking you to do, and what we're so thrilled that the city is looking at doing, is to work with us in community accountability, to take the pledge, to in fact sign that and work with the community. We see you as a partner, we see MCFD as a key partner, and we believe that together we can make a huge difference to children and families in our community. Thank you.
Thanks very much, Ms. McGuire. You don't have any questions. Our last speaker is Deborah Page.
As I sat there, I get more and more nervous. Thank you for putting me on your agenda. My name is Deborah Page. I am the great aunt of Paige Gaucher, the subject of the report. And I guess this is going to be a more personal look at the situation. I came down here on an 18-hour Greyhound bus ride from central interior Vancouver. Yesterday I arrived. The bus route took me through Kamloops. The bus depot in Kamloops is right near where the Kamloops Cemetery is. In that cemetery lies the cremains of Paige in an unmarked grave. The grave, she was placed there with her paternal grandmother. Also at the same time, we placed the cremains of my sister Bonita. That's the grandmother of Paige. My sister died in 2008. She drank the medicine that they gave Shanda to prevent her from craving heroin. She committed suicide. The remains of Paige's mother, Shanda, I still have those at my home. They will be also scattered on the grave of Paige. So we're talking here 3 generations that have died as a result of 1, using suicide, and 2, from drugs. Paige, as you know from the report, and maybe not all of it, was found dead in the washroom, the shared washroom of the Umoto house. And I believe Umoto house is a home for homeless girls just down from Open Miner Park, in the downtown east side of Vancouver. From what I saw of the place when I came down for a page, it was like a warehouse for people they didn't know where else to put. That's where she ended up, in the poorest neighborhood in Canada. When I received a call from my sister-in-law, Fran, about Paige, it's a call you don't ever want to hear, received, I tell you. I thought she had meant to say Shunda was dead. That's Paige's mom. I had been expecting that ever since my sister's death, because Shunda was such a damaged person. She was so damaged from drugs, and then the damage that was caused by her overdose and the brain damage that was caused. I expected her to hear that call. I'd prepared myself for that. It was just a matter of time before I heard that news. And I said to Fran, "You mean Shunda?" She says, "No, they found Paige dead at that place they put her in." I expected to hear Shunda. I was shocked to hear it was Paige. I was actually shocked. I had no idea about the terrible life she was living down here. She was here because I had sent for her when I lived here, when she was abandoned in Penticton. But I couldn't stay here because of the cost of living in Vancouver, so I had to return up north, but she stayed and Shunda stayed. Living in single occupancy rooms in the downtown east side. Nobody told me. Nobody contacted me to say that she'd been brought to the hospital. Nobody contacted me to say that she'd been found on the streets intoxicated, that she had had 3 abortions. Nobody contacted me. She would phone me. I gave her a phone me anytime you want, Paige, phone collect. And I say, "How are you doing, Paige?" "Oh, I'm doing good, Auntie. I'm doing really good." And on her Facebook, I talked to her, "How are you doing, Paige?" "Oh, I'm doing good, Auntie. I just worried about Mom." No idea. Nobody contacted me to say that she had been living like that. The image that I have stuck in my head is my poor little Paige laying dead on a cold floor of a shared washroom in the downtown. That's the image I have here. It still haunts me. And also stuck in my mind is the image of her mother, Shunda, found dead of a drug overdose in a single occupancy room on Hastings Street, alone. Also stuck in the head is the image of my sister laying dead on the floor of her apartment after taking her own life. Less than a year after the death of her daughter, Paige, when I talked to, they phoned and said Shunda was found dead. When I talked to the Vancouver police officer that attended her death, he told me that he had received several reports of Shunda stopping people on the street saying, "Have you seen my daughter? I can't find Paige." In her brain damaged mind, she didn't remember that her daughter was dead. She kept forgetting. When they did the report, they painted Shunda as this horrible, horrible mother, and she was not a good mother. She was 16. She was 16 when she had Paige. She tried. I have a picture here. I don't know if you can see it, but this is Shunda holding little Paige as a baby. She had so much hope. I don't know if you want to pass it around or not. She had so much hope with the little girl. As soon as she found out that she was pregnant, she stopped drinking, she stopped smoking, and she did what she could to have a healthy child. I know I'm out of time frame. But I have an image of her mother, Paige's mother, Shunda, as a 4-year-old little girl sitting on the back seat of the RCMP vehicle. She had asked me to please come pick her up because she'd been left alone for a couple of days. And I brought the RCMP because I didn't know what I was going to find. I wish I had received that call about Paige and from Paige, but I didn't. And I want to talk a little bit about our family's story. It starts in 1922. That's when the Lejac Residential School was opened. And the first person that was apprehended, I put apprehended, was my grandmother. She was forced to go to the school against her grandmother's wishes. And I'm sorry, I'm lost my place here. My mother followed. My mother was taken at age 6, and at age 16, when they received no more funding, they put her out. And when she came out of that place, she was angry and damaged. She had no ability to show love, not even for herself. And she came to Vancouver after my grandfather enfranchised because he had no rights to vote or no rights to enter public buildings after he came back from the Second World War. He gave up his rights to be able to do those things, and our family was removed from reserve, and that's how our family ended up in Vancouver. Came down looking for work and a place to stay. My mom started her family here in Vancouver, but she had problems. She didn't know how to parent. Anything she only can respond with anger, and that's what we grew up with. That's what Shunda grew up with. That's what my sister Bonnie, who committed suicide, we had no parenting skills. We had no intervention to say this is right, and we were apprehended, my brother, myself, and my sister Bonnie, that's Paige's grandmother, when Bonnie was 1 year old. And it was such a horrible experience that we never ever told anybody after that we were abandoned. So this Paige's story, it's a multi-generational story of dysfunction and of poverty and of neglect and of apprehensions. And Paige's response, Shunda's response, my sister's response, my mother's response to that is to kill the pain, to stand the poverty and the things that happen to them. So when the kids come to Vancouver, they come various reasons. Sometimes they're born here, sometimes they come here to escape the reserves, because the reserve are not any more healthy than the downtown east side. I hate to say it, but the generations go on and on. So I just wanted to speak to it on a more personal basis, how it affected our family, how nobody contacted either myself or my brother or my sister-in-law about what was happening to Paige, and how she was put in a place that had no supervision. So I just wanted to talk about that.
Well, thank you very much for your journey and for your courage in sharing this with you. I think Mayor Robertson would like to say something.
Yeah, thank you, Mr. Chair, and a big thanks to you, Deborah, for being here, your courage to be here and to continue being a voice that makes sure Paige's story, the story of your family, is told. I don't have any questions for you, but I just wanted to speak to thank you for being here. Disappointed that all the TV cameras left, because we spend a good chunk of the morning talking about all of the tragedy and the overdose deaths that we see on the streets, many of which are kids like Paige, who have slipped through the cracks for generations now, and the impacts just keep mounting. But the only way we turn the tide on this is voices like yours having the bravery to stand up and tell the honest truth and share your wisdom. So I want to.
If anything can come out of the death of my little niece, who was so smart and so promising, that would be a good thing.
Thank you. Thank you for being here. And
yes, thanks.
I just want to acknowledge the rest of the family here as well. Thank you for being here as well. And I'm happy to move the recommendations and the motion. So the city takes our next steps, making sure that we continue to raise our voices for the kids at risk who need our support, and make sure that support's there, whether it's related to Homeless Action Week or to the work that's being done by these great organizations. We had great presentations. Thanks to all of you who've shown up here today to talk about the work that's happening day in and day out. You work so hard at this, and I know it must seem like an uphill battle most of the time. I'm hopeful that we're going to see real change with a provincial election and lots of resources that should be focused on our kids and most vulnerable people in our city and around the province. I'm hopeful if we can keep pushing hard as a city, we can keep getting together like this and making sure the stories are told, and that we call out loud and clear for more support. Thanks all of you for being here, and let's keep this good work going.
Thanks, Mayor Robertson. Seeing no further speakers, I'll move it to a voting screen, please. And all those in favor or opposed, please show. And that passes unanimously. Thanks very much. And thanks again for making your journey here today. So with that, I think we only have 5 minutes. We should break for lunch. I propose we return at 12:30, and we'll move straight into our next item at that time. Yeah, seems reasonable to me. There's a few living wage speakers, but there's some living wage speakers, but they don't all have to be questioned. Okay, as soon as everybody's in their chair, we'll resume. Okay, so sure. Well, let's call this meeting back to order. We have a presentation, Ending Violence Association of BC and BC Lions Partnership. Tracy Porteous and Jamie Terrace.
Thank you very much. It's a pleasure to be back speaking with you again today. I want to just come back to a few things that were spoken about this morning because I think it's very apropos to talking about ending gender-based violence. We were hearing some terrible outcomes of what happens in the aftermath of poverty and racism in residential school. And I can say with quite a level of confidence that Paige and a number of the other youth that commit suicide that you were hearing about this morning probably experience sexual abuse in their childhoods, in their homes, and no doubt are experiencing sexual assault on the street. And I think that the issue that we're here to talk about is trying to change the conditions that allow violence to happen in the first place is quite significant in terms of our path forward. Almost every survivor that I've had the opportunity to speak to, and I've been working in the anti-violence field for 35 years, has expressed a sense of betrayal about the people around them, why they didn't speak up. If they were a kid or a teenager or even a woman, why the people around them at work, or why their teachers or why their social workers didn't do more for them. And so my organization, the Ending Violence Association of BC, went to the BC Lions about 6.5 years ago with an idea that perhaps together we could combine our efforts to change this social phenomena of silence, to try to encourage people to speak up and not stay silent in the face of gender-based violence. We know that contrary to a lot of what you might see in the news, that violent crime is going down. We see a lot of police reporting violent crime is going down. But if you disaggregate sexual assault and domestic violence, these crimes are going up, in fact. Our province has had more domestic violence deaths every year for the last 4 years than we had in the previous 10. And sexual assault across Canada is also on the increase. And so this is happening at epidemic levels. 50% of women are experiencing this at some point in their lives. 57% of Indigenous women, and I think that statistic is probably quite conservative. 83% of women who live with disabilities, and over 50% of transgendered women are experiencing this kind of violence in their lives. And of course, this kind of violence costs a huge emotional toll in terms of lifelong impacts in terms of health and emotional health and mental health. But it also costs the system billions and billions of dollars. I saw a report come out looking at the justice system just this morning, and unfortunately the report is helping us understand where the provinces or territories are at in terms of a report card. And BC is scoring the worst in making sure that victims get support from victim services that are there. So this program that we developed, it's quite creative and quite awesome, I will say, because it's really the first time we've seen men engage in a violence against women movement. I think it's the new wave. So we're going to show you a little bit of a video to help tell the story in a much more powerful way than I could ever do. No sound. There's no sound. Yes, very polite. The sound.
In our house, we win. In our house, we defend and protect each other.
It's the third attack on campus in as many weeks.
This man did manage to get his hand up her skirt and rip at some of her clothing under her skirt and also punch her in the face.
3 counts of first-degree murder.
18-year-old Van Diest was beaten to death on the train tracks beside the trail.
An incident occurred in my own house that I had to deal with. And fortunately for me, I was old enough that I could deal with it on my mother's behalf. And and there's times that's not the case at all, right?
That's why we've partnered up with the Ending Violence Association of BC to begin to create a positive change in this province.
In British Columbia, there are over 1,000 physical or sexual assaults against women every week.
Being more than a bystander isn't a superhero approach. Countering violence with more violence isn't the answer.
Tell him to stop. Distract him. Change the subject. Talk about it with him later. Talk about it with her. Make sure she's okay. Tell someone else. These are just a few ways to stand up and be more than a bystander. Break the silence on violence against women.
I think that men's violence against women and children is one of the great, sad stories of our time, and that all the other things we can do well as human beings, one of the things we're not doing very well is preventing this from being such an enormous problem.
So it gives you a little bit of a picture of what our program is about. My name's Jamie Terrace. I'm the Director of Community Relations for the BC Lions Football Club. I did play for a few years, but now nothing works at all for me. So at any rate, I just want to say that what a tremendous privilege it's been to be a part of this program. When Tracy first approached us about getting involved, to be quite honest, I had concerns. We know football, and we had a lot of community programs. We were involved in the community, but this was such a serious issue. Many of the things we did were very light and touchy-feely type stuff that was easy to do, talk about goal setting, what have you. And this was a very, very harsh and real issue. But really, at the end of the day, what has worked for us is that when Tracy and her colleagues and Jackson Katz, who you saw in the video, told us that this is really about leadership. And at the time, very few men were speaking up. when in reality the majority of this violence is being men against a woman. It's man's violence against women in the large majority of cases when it comes to gender-based violence. And so we had a tremendous opportunity to have a platform and to get involved and to make a difference in our community, and so we took it. So thanks to Tracy for thinking of us, and it's been a wonderful journey along the way. So the program really is about, it speaks to the bystander, it speaks to all of us, men and women, but in particular men, in our ability to not to the perpetrator or to the victim, but where we recognize things that are going wrong in front of us, we have the opportunity to say something, to do something, to get people that can help involved, rather than doing nothing. Because by doing nothing, we're saying that it's okay. And so I think that's really the crux of the program, and it has been a wonderful, wonderful relationship. It launched in 2011, and we have had tremendous recognition and awards, including being featured at United Nations, where Tracy traveled down and talked about this program. It was highlighted as a program around the world that was recognized for what it was trying to accomplish. But besides the awards, really, and for the lady that shared with us this morning, it's really important to recognize that at the end of these programs, there are real people that are being affected, lives that are being damaged, and not just the woman's life, but their children's lives, and the generational damage as well that we heard about this morning. So anyways, what we're really asking today is, for those of you that don't know, the city has been a municipal partner of ours for 4 years. We had a lapse last year, not due to you, but due to us. We got so busy with the program, we forgot to ask. We're here today asking you to come back on board as a municipal partner. And so there's a picture of Mayor Robertson in one of our launches. But at any rate, the program itself is really about 3 components: in-school presentations. So up to date to now, we've done about 116 school presentations. We've affected over 65 or 68,000 youth. I think Tracy has a higher number, and God bless Eva, because they do all the counting. So there's the in-school presentations, there are community presentations and presentations to amateur football. And what we're trying to do in talking to the young people is to change attitudes so that they will look at things a little bit differently, and also to give them tools to get involved. And how do you be more than a bystander? How do I say something? How do I do something when I know something is wrong? The other part of it is publicity and promotion. So you probably have seen our players out there on radio, on television, in stadium, in print, talking about this issue and speaking about this issue. And so that's another big part of the program itself that has been very well received and very successful. Just some pictures of that. And as I say, we've also been to many schools here in Vancouver, and I have a listing of some of the ones that we visited here. There are obviously many more to visit. And that's really the second part of the message. While the program is very successful, there's a whole lot more work to do. And we often equate it to smoking, changing attitudes about smoking, or changing attitudes of Mothers Against Drunk Driving. It takes a long time for people to change their attitudes. And we've got a lot of work to do, a lot of work ahead of us. But things are happening, and good things. So we do exit surveys with about 5% of the students and participants in the programs. And you'll see some of the before and after, where before they may not know much about violence against women, and afterwards they know quite a bit, as evidenced by the orange or red in the graph there. And also about ways to be more than a bystander, where they now have after coming out of our presentation, know that they can say something and have a way to interact in an appropriate way that's going to be effective and safe for them as well. I talked a little bit about also, so this is just an example of the Senior Bowl, some of the best football players in the province that we were able to present to, hoping that they go on and create a leadership culture in their own schools and communities where they head off to university and to colleges. So one of the ways that we're going to recognize you as a municipal partner is in each of our presentations. So you'll be recognized both on our playbook and in the PowerPoint that we do for the students. Also in the PSAs that we show in stadium, you will be recognized also as a municipal partner. This is just an example of what that would look like. Also, you'll be recognized on bclions.com and endingviolence.org as one of our partners. And this is an example of the websites themselves. And I know Tracy's website, when we started this program, increased dramatically in terms of the number of hits, which is both a good thing and a bad thing, recognizing that there's obviously an issue out there, and a huge issue, but also that people are finding a way to get help. So one of the other things you did for us that we'd like you to continue is a transit shelter advertisement. So you gave us 10 transit faces over 6 weeks, and that was very valuable for us to get the message out there. And we'd ask you to come on board and do that again. This is a picture of that. So there is an opportunity for you guys to come back on board as a municipal partnership. That really is part of our ask today. And there are two other things that, the ways that you can support us that Tracy's going to speak very briefly about.
Yes, thanks, Jamie. And just very, very briefly, I've been part of the Leadership Council of the City of Vancouver that Dr. Penny Ballum started a number of years ago, and I feel very privileged to be at that table helping Mary Claire and others develop the Healthy City Strategy. And one of the components of the city strategy is to try to do what we all can to make the City of Vancouver as safe as possible. Because right now, post-Picton and post a number of tragedies that have happened in and around Vancouver, Vancouver is considered one of the most unsafe cities for women. And I think as a counter to that, what we're all wanting to do is to ensure that we are making moves to make Vancouver a safer city. And part of that, one idea that I brought to the table, is similar to what we've been doing with the Bystander message. We've been taking it across the country. There are 5 other CFL teams that have now adopted a Bystander program. We have trained the Winnipeg Blue Bombers to go out to schools across Manitoba with the same message and with the same program. We've trained Saskatchewan amateur football, we've trained BCIT, and just last weekend SFU. So they're all taking on, we're training their leadership to take this program into their campuses or their networks. So one of the things that Mary Claire and I have talked about is perhaps we could train leadership within the City of Vancouver. You have 10,000 people, which is a huge force to be reckoned with. If you all of a sudden had 10,000 people in the City of Vancouver that had the skills to know what to say and how to speak up and had the confidence to know what to say when they heard racist or homophobic or sexist jokes, or worse, saw abuse or knew of abuse going on around them. So we would love to see you embrace the idea of either we train all of the city staff, us and the BC Lions, or we train a smaller group of leaders and you train your own people. So that's the other idea we had. And then thirdly, we've been trying to figure out a way of extending the invitation of this program in terms of transit shelter space and the message to other mayors and council across the province. I know it's probably not realistic to think about next week when you're all at UBCM to pass a resolution or bring forward a resolution to the floor of your colleagues to provide them with an idea that there might be something that they could do concretely as local government in their areas to help people in their communities and their constituencies to be more than a bystander. So we're happy, I mean, if there is a chance that there's somebody's willing to bring forward a resolution, I'd be happy to drop whatever I'm doing to try to draft one for you to take. So thank you again for your support up until now. And we very much hope to continue to be working with the City of Vancouver as the years roll out ahead. Thank you.
Thank you. I see some speakers, but I just wonder if perhaps I'm missing some. So there's a request here for support. Is that already been done? There's no, I can't, maybe I'm missing a staff report here or a recommendation, but is it just a presentation today, Ms. Zach, or?
Yes, it's just a presentation today. We have supported the program in the past, and I can certainly discuss that with Kathleen, and we can see how we can perhaps do that going forward again. And certainly the training opportunities are something that we're in discussion about right now.
Okay, so Councillor Genova has questions.
Thank you very much for the presentation. It's something that I think is so valuable. We don't really get to see the tangible numbers in prevention sometimes, but especially putting those dollars into prevention, that's where they are best spent, and I think that you summarized that perfectly. I'm wondering, and it's top of mind for me because myself and Councillor Ball just attended at the University Women's Club a reception for 2 international experts who came in to talk about their approaches on addressing issues with prostitution and speaking about trafficking and how it starts really for both sides, for the men with violence in the home and for these young women with violence in their homes as well. But culture came up, and that was something I didn't hear you speak about. So is there anything that you're able to do to reach out to different cultural groups in Vancouver here? I understand that you're going to the schools, and and in speaking with the children and the teachers and kind of, throughout the community, you are reaching people, but are there any ways that you're specifically targeting specific cultural groups throughout Vancouver? I'm not saying targeting one or the other, but being able to reach out to all cultural groups, especially where domestic violence, there may be some stigmas attached to that.
It's a great question. I think probably one of the things that you're referring to is the 2005 two-year time frame where in Surrey we saw a huge number of South Asian women murdered as a result of domestic violence, and we're hearing all too often about the disproportionate impact of this kind of violence on Indigenous women. So violence, it needs to be said, crosses all cultures and all communities. It doesn't live in any one place. We have been very carefully selecting bystander spokesmen among the BC Lions that are representative of a diverse group of men. So as you saw some of the images, many of the men are men of color. Some of the men are Indigenous men. We had, in the first couple of years of the program, Bobby Singh is a retired BC Lion, so even though he wasn't working anymore, because of the huge population of South Asian folks in the Lower Mainland, we knew that we needed to have diverse men speaking about this. We don't have Bobby anymore, but we understand that there's a new young South Asian guy on the practice roster, so I'm putting a good word in for him. But more importantly, and very specifically, one of our most powerful bystander spokesman players who's retired is a fellow by the name of J.R. LaRose. He's from One Arrow First Nations in Saskatchewan, and he's been going across the province speaking to groups of Indigenous folks. So lots of band councils and chiefs are coming to us saying, we want JR to come to our community. So we could probably provide you with a list of about 30 Indigenous specific communities that we've sent JR to. One-off kinds of things. We're also very conscious when we do our road trips. We do schools in Vancouver, schools in Surrey, and then we try to go to 3 other communities every winter in the off-season. And we're conscious of wanting to reach communities that are both diverse and Indigenous.
Thank you very much for all of the work you do.
Thank you, Councillor Reimer.
Yeah, Chairperson, I hope you'll indulge me a bit here. I just sort of wanted to point out perhaps what staff, the direction they were leading. Like, we do very much appreciate the work. I was kind of wondering, we've had the annual update for many years. We didn't hear from you last year, so I'm glad to see that we're still talking about how we can collaborate. It would, however, be very impractical for council to receive direct requests like this for funding, given the thousands of potential nonprofits in Vancouver that, well, they are actually nonprofits who could potentially come and speak at the microphone. So we do have a well-established process that meets the administrative requirements of our auditor for applying for funding. And I understand you're connected with staff, so I'll leave it to them to do that. But if there's ways that council can be helpful directly, either through political work or other things, we'd be really pleased to talk about that. Advocacy obviously is a shared thing. I think my own experience has been that without male allies, it is impossible for us to see significant change on issues that are so specifically targeting women. Yeah.
I could just say very briefly, apologies in terms of protocol. We very much wanted to give council an update in terms of what we've been doing over the last number of years, and couldn't help ourselves with the idea of just telling you where we're going. And we definitely would be working with Mary Claire in her office. And in terms of not coming last year, I've never seen this much awareness on the issue of violence against women in my 35 years. Police, institutions, universities, we're working with everybody, not just in Vancouver, in BC, but across the country. So this is this feels almost like a moment in time that we've never seen before. Like in terms of the social change window is now open, and I feel this tremendous sense of responsibility that's collectively held, that we have an opportunity to make some big change right now in terms of policy and programs. And I agree with the mayor that with the upcoming election, perhaps we'll see something different than we've seen in the last number of years. But I keep thinking about hashtag our time is now. And for what that's worth, really appreciate your words.
I don't think any apologies are necessary, but staff will put it in a form that it may not need to come back. Perhaps it can be resolved some other level, but we're happy to be here more. Councillor Stevenson.
Thank you. Thanks very much. I have to say I was really surprised and saddened to hear that Vancouver has the worst record regarding violence against women in Canada, and wonder, well, it's hard for me to think about Toronto and Montreal and think they have a better record. And so I guess, first of all, the question would be, what are these other cities doing and have been doing that has meant they're so much better? And is there some ethos in those cities that we're missing somehow, or different kinds of men? My experience is with 3 daughters, and all 3 daughters have talked about the fact that they feel very safe in Vancouver, particularly because of the high density in the West End and downtown. There's usually always people around. So I'm shocked to hear that we have such a bad record in comparison with this entire country.
Well, I can't speak for Montreal, but I know that the city of Toronto has 1 police force. And I think so communication, the number of women that fell through the cracks in terms of Picton, where women were saying for years and years and years their girlfriends were going missing. And there was a very complex, complicated number of errors that happened between the RCMP and the City of Vancouver, which we've all seen, and it was a result of the Commission on Missing and Murdered Women that was presided over by Wally Opal. They've made a number of recommendations. In the last 33 years, there's been a number of recommendations. In fact, since the death of Sunny Park, who was murdered with her son and her parents by Peter Lee in Victoria, my organization has estimated that there's been 176 recommendations made through reports by Mary Ellen Trevella-Fond, the coroner's office, and others in terms of across the province. And only 4 of those recommendations have been partially implemented. I know in Ontario, just since the premier that's in power now, Kathleen Wynne, has been there, she is investing millions and millions of dollars in community services on the ground that are often the first point of contact when somebody is experiencing violence, who is afraid for her life. I mean, you heard about many of the programs that are working with youth here this morning, and they sound like they're doing amazing work. And there are, under our umbrella, there are 240 anti-violence programs in the province, but none of them have received any further investment for 25 years. So many of them have 1 staff, and they have caseloads of 300. So I think that there's a major investment that needs to be made, and I appreciate these are provincial responsibilities. We're also talking to the new federal government about whether or not there's more they can do in terms of transfer payments and putting tags on transfer payments needing to be spent on changing the dial on gender-based violence. But I don't think the issue of not having enough programs is the only answer. But I think the Access to Justice report that came out today that said BC is the worst province in terms of connecting victims to the services that already exist is another part of the problem.
Councillor Ball.
Yes, thank you very much for coming in today, for both of you. Whenever you work with young people and young women, you always hear them trying to protect their parents, but they'll tell you the truth about what their lives are like and the challenges they meet every day. We have a number of wonderful organizations in the city who are trying to do the kind of work that you're doing and are approaching it from different angles. And I think all of them are tremendously needed. It's very interesting to me to hear about the program, and because I do know how it has affected a number of boys who heard things in a different way because they were by a guy they admired, that they had followed. And I'm interested in knowing how you were able to get your speakers, how difficult was it for you to get guys who were on the field to come in and to be able to talk about these issues, which are not easy issues to discuss in any case, but What happened? How were you able to make this happen?
Well, I think first off, it was alarming how many people came out and talked about how they had a situation in their own lifetime. Coaches, including you saw Wally Blano, but also other coaches and players that you found out this issue had affected. So, and of course, guys don't talk about this stuff, so none of us knew about it until we got involved. So in the case of J.R. LaRose, whose own mother experienced sexual and physical abuse during her lifetime, it was an obvious choice for him to get involved. And we handpicked the guys, obviously. The guys that are, the good news is we've been involved in the community for many years in many programs. We actually had a number of players that were very well versed at speaking in public and particularly to youth, because we'd been doing it for so many years. So we kind of had a trained group there. And then it was a matter of matching the right guys that identified with the program. But really, when you look at it, we all live in a beautiful country of Canada, in one of the best provinces, and in a wonderful city of Vancouver, and yet 50% of women are being physically or sexually assaulted or abused during their lifetime. You know, as a man, when you hear that, it's disgusting. So really, it wasn't that hard to get the guys involved. The harder part, they will tell you, was the training. We did 3 8-hour days of training for our guys, and they'll tell you it's like a fish story that it was a week of 10-hour days, but it was actually 3 8-hour days. And we had Dr. Katz come with another colleague, Daryl, who are experts in gender violence, because we obviously aren't, just to help us to learn about the issues and also to communicate effectively about the issues, and really relying heavily on Tracy and her group, particularly when we're in the schools, because some people will disclose to us, and then what do? We certainly don't know how to deal with that. So to have them with us, to have Ending Violence as our partner, to say, hey, listen, I'm very thankful that you told me this is very important. I'm very sorry for what happened, and I want to introduce you to someone that can help you, because that also happens. We have had disclosures in the schools, and having that ability to deal with it as well has been, I guess, comforting for us, because we know football real well, and we're certainly not gender-based violence experts, but we do feel like we have a voice, and for whatever reason, kids in particular listen to us.
And the next question I have is, do you find that all this training has affected the business aspect? Has it flowed through the organization? What are you seeing that's
Good question. Yes, our entire staff, including our executive, has received gender-based violence training. All of our players received it last year and will be receiving it again this year. And as Tracy said, the CFL has adopted a policy around gender-based violence, and each team across the CFL it takes training, the players and staff. So it has certainly evolved. It's grown, and we are seen here in the province of British Columbia as leaders in this area, particularly as it relates to the pro sports field. So we're able to help share our experiences with them and help them as they grow in their own programs. So certainly it's changed. And our locker room, that's the other part. Our locker room's changed because we have issues as well as every organization does. And the good news is we've got guys like Travis Lulay as part of the program. So, you know, when something inappropriate is being said or done in a locker room, he can stand up and say, hey guys, you know, be more than a bystander, and they understand. And I think that if you ask any of our players, the culture in our own locker room has changed as a result of being a part of the program.
Well, that's wonderful. I mean, given the very sad subject, to have hope and to have the kind of education you're doing is terrific. So thank you both very much. Thank you.
Thank you. And I just want to echo what you said, because I think that this program feels like one of the most important antidotes to the tragedy of this kind of violence. And and as I said previously, this kind of violence has been allowed to carry on because of the silence. People don't know what to say and what to do. So many previous gender-based violence prevention programs were focusing on groups of girls and trying to help them figure out how not to be raped, or getting boys together and telling them like how to, you know, be more respectful to girls, essentially kind of pegging them as potential offenders. But nowhere until this program has come along have we been getting everybody together and saying to everybody that we're all bystanders to this. We all know somebody who's been affected in this way, and empowering whole communities and society as a whole to give them the tools and the know-how and the confidence to be able to speak up and not feel helpless when they see this, as they no doubt, we all see it every day, right?
Well, a real hurrah. Thank you. Thank you very much.
Thank you, Councillor Jang. Oops, sorry.
There we go. Thank you very much, Mr. Chair, and thanks for coming. I'm glad you raised UBCM. I'm the Vancouver representative on the UBCM executive, and it's unfortunate we didn't connect this year is because it could have gone to convention, which happens next week, as you point out. So if you want to be part of UBCM, or certainly to get it on the floor of convention to be debated and discussed, bring awareness to every single municipality across the province, please connect with me and our staff, and we can look at creating. There's a process we have to go through, so we have to write a resolution. It has to be passed here, LMLGA, then it goes to UBCM. So there's a process we need to follow. But certainly for next year's conference, which I believe is here in Vancouver, it would be very good to have it ready to go. So happy to work with you. Just let us know, and we're on it. You're welcome.
Councillor Carr.
Yes, thanks so much, Mr. Chair. Well, Councillor Jang just beat me to it because I'm a council representative to the LMLGA, which is the Lower Mainland Local Government Association. It's the sub-regional association that then puts forward resolutions from there on to the UBCM. So it's great you've got Councillor Jang already offering, and I certainly will offer my help in whatever way possible, because I think what you're doing is incredibly important work. The partnership and the leadership are phenomenal. The issue is tragically too big, and it needs to be tackled. So thank you for the work you're doing, and we'll continue to help you forward your particular program on with others.
Okay, thank you. So that's all your questions. Thanks very much for the presentation. I'm sure we'll be hearing more about you in the appropriate forum soon, and thanks for all your work on this area. Our next presentation is Baldwin Wong, and Ms. Zach, are you going to introduce this one too? Or, and again, it's a presentation but not recommendations, so there'll be a chance for questions. And then.
Yes, we're pleased to present a strategy called the New Start for Settlement and Integration for Immigrants and Refugees in Vancouver, and this came about as a result of a partnership with the federal government. But I think more importantly, a significant partnership with community, business, and other local residents, et cetera. So without further ado, I'll have Baldwin walk you through it, and we'll respond to questions. Okay.
Thank you, Mary Claire. Good afternoon, Mr. Chair and Council. Baldwin Wong from Social Policy and Projects. So following up on Mary Claire's comment, today's presentation is to provide Council with an update on the Vancouver Immigration Partnership, otherwise known as VIP or VIP, and specifically about the New Start Immigrant and Refugee Settlement and Integration Strategy in Vancouver, which is developed by the partnership over the past 16 months. Hard copies of the strategy have also been provided to Council. Mary Claire, Zach, and myself will be available to answer any questions Council may have after the presentation. Our presentation focuses on three key aspects of the partnership to date. Firstly, we'll speak a little bit about the context and background as to why we are undertaking this initiative, some key learnings from the process, and the approach taken by VIP partners in developing the New Start strategy. We will then highlight the priority actions proposed in the strategy, and we'll conclude with some comments on the next step of VIP and its implementation. VIP is built on a lot of current and previous work undertaken by the city and community partners. The city's Healthy City strategy, which sets out a vision of a healthy city for all, lays the foundation and specifically informs VIP through four key goals, including access to human services, making ends meet, feeling connected and included, and collaborative leadership. These four goals of Healthy City strategy correspond to the four theme areas of the New Start strategy. The strategy is also aligned with Healthy City Strategy's implementation timeline, which is from 2016 to 2025. By way of background, in 2014, Council approved for staff to enter into a contract agreement with the federal government to undertake VIP. The two-year agreement has been extended for one more year until March of next year. We expect the federal government to renew the agreement soon. Total project funding from the federal government to date is approximately $650,000. But beyond federal funding, the city and VIP community partners also made significant in-kind contribution towards the initiative. VIP is part of a national program called Local Immigration Partnership, or LIP. We brand the Vancouver initiative by replacing the word local with Vancouver, hence Vancouver Immigration Partnership. The federal government supports LIPs across the country, and in BC there are a total of 19 LIPs, of which 9 are within the metro area. The City of Vancouver and the City of Surrey are the only 2 municipalities in BC which entered into an agreement with the federal government to conduct a LIP. In 2005, the cities established, or actually I should say the mayor of the time established the Mayor's Working Group on Immigration to advise the city on immigration-related matters. The working group is the governance group for VIP, with the support of current co-chairs, Councillor Jeff Max and Professor Dan Hebert. With Professor Hebert retiring from the co-chairing recently, Cecilia Tagle has now stepped in as the interim co-chair of the group. VIP is also aligned with the working group's vision and value statement as adopted by Council back in 2008. The statement confirms the need for cities to play an increasingly important role in the inclusion of newcomers. That inclusion is consistent with the city's commitment to reconciliation by honoring and valuing the role of First Nations, and that the city is proud of its cultural diversity as is committed to fostering an open, welcoming, and safe environment for people of all backgrounds. Demographically, Vancouver is one of the most diverse cities in Canada, if not in the world. Based on the 2011 National Household Survey, 48% of Vancouver's residents were born outside of Canada. And I heard Toronto is 52% now. While immigrants are an integral part of the city, bringing with them talents, skills, and the desire to succeed, they also face many barriers. For example, while we know that there are more immigrants with high level of education than local born, there are more immigrants who are unemployed or underemployed than the local population. 8% of Vancouver residents cannot converse in either English or French, our official languages. These issues are fundamental in developing the actions of the New Start strategy. The federal LIP program has 6 key objectives. Over the past 2 years, VIP Partners has completed the following 5 objectives, including 1, build a broad and representative partnership council. In this case, it is the Mayor's Working Group with other groups. Second, conduct research on newcomer needs. Third, to identify community assets and gaps. Fourth, to raise awareness with partner groups and the broader community. And fifth, establish a local settlement strategy which aims to improve the newcomer settlement and integration experience. And this is the New Start strategy that we're speaking to today. The one remaining objective, which is to develop action plan and implement the strategy, will now start with the official launch of the strategy today. I should highlight that VIP's been well supported by nearly 120 people from 72 organizations in Vancouver, and they made up the VIP partnership. A range of groups ranging from the Mayor's Working Group, I just spoke about, to 4 strategy groups and a research advisory committee have played key roles. Today, 2 of the strategy group conveners are present, Joan Anderson from Mosaic, who leads one of the strategy groups, and our own Mary Claire Zach, who leads the other one. Other conveners include First Nations leader like Corey Wilson, UBC advisor to the President's Office, Robert Dome, Eleanor Guerrero Campbell, and our own Assistant City Manager, Wendy Yao. Professor Miu Chen Yang is the chair of the Research Advisory. So within the partnership, service organization, directors, university professors, frontline workers, First Nation leaders, business representatives, community organizers, and government officials all participate as members of VIP. Senior city staff, including from the city manager's office, real estate and facilities, engineering, community services, park board, Vancouver Public Library, and VPD also participated in the process. We thank them for their tremendous contribution. We should also mention that close to half of VIP members have immigrant backgrounds themselves, and they bring a wealth of experience to the discussion. Building on the Healthy City strategy, VIP addresses 4 theme areas. Over the past 16 months, the members developed a total of 28 priority actions under the 4 themes. Other actions are also proposed, and they are included in the New Start strategy document. The 4 themes of VIP are access to services, intercultural and civic engagement, welcoming and inclusive workplaces, and governments and public institutions addressing needs. Before we provide more details about the strategy actions, we'd like to share some important research findings from VIP. In 2015, we conducted a survey for immigrants living in the city. Over 1,800 immigrants responded. On this particular slide, we chose 4 key questions from the survey and provide the top 3 responses to each of the questions from the immigrant respondents. First, we asked immigrants what are the services they need most. And the top 3 responses are health and wellness, finding jobs, and English language programs. We also asked immigrants where they make friends and connections. There has been studies and other research done that talked about how immigrants often feel isolated in the community. And the top 3 responses to this question are at work, in language schools, and at local community centers. Third, we asked immigrants how they find jobs. It's not easy. And given employment is so important in the settlement process. The top 3 responses are through websites, family and friends, and professional connections. The last question we'd like to highlight is from a city perspective, because we asked immigrants what civic amenities or facilities they use the most. And they ranked the top 3 as public libraries, parks and gardens, and community recreation centers as the 3 most used civics facilities. All these findings provide important data for the VIP members to consider in their strategy and action development. So the New Start strategy is the culmination of 16 months of work by the 120 members of VIP. In the strategy book, there are specific chapters dedicated to each of the theme and details on what the actions entail and how they're being proposed. For today's presentation, we're highlighting some of the priority actions areas under each of the theme. Under the access to services theme, VIP proposes 4 priority action areas. They are mapping and assessing key service systems which support immigrant settlement and integration, including in the areas of mentorships, settlement services, civic services, and broad-based community services. This kind of exercise has been undertaken by other LIPs in Canada and proven to be useful. Second, enhance relationship building and collaboration opportunities between settlement agencies and broad-based community sector. As we know, immigrants require support beyond the settlement services organizations. Third, propose public awareness campaign to promote immigrant newcomer services. A recent study showed that only 30% of all immigrants, at least on the western provinces, use settlement services. And also our own immigrants survey indicated that many immigrants are not aware of what are these services. Under this action, there's interest to launch a Tell a Friend, for example, campaign in the fall. And we are in the process of supporting, for example, working with Langara College and students there and local neighborhood houses to pilot such a campaign. Fourth, recommend community or volunteer-based initiatives to enhance ESL learning opportunities. So many of the respondents to the survey indicated that language is still a major concern. Even if they speak some basic English, it may not be at a level where they are able to use that in the workplace. So this action is to start more local, for example, conversation clubs for newcomers, and hopefully this can avoid some of the long wait lists for government-funded ESL programs. The second theme, which is intercultural and civic engagement, VIP proposes 8 priority actions. We're summarizing them into the four following areas. To develop initiatives to engage immigrants with long-time residents, including with First Nations, and this can be built on the city's work through the Vancouver Dialogues Project and current reconciliation work. 2 is to build on city's recommended action in the Engaged City Task Force, such as outreach strategy to immigrants and youth, and increase participation in civic election. We do look forward to initiatives supported by the Canada 150 celebration as well. Third, continue the city's work on reconciliation and addressing historical injustice issue. And fourth, actions that support conducting ongoing dialogues among cultural communities and with youth, especially on issues pertaining to identity and belonging. Under the third theme of welcoming and inclusive workplaces, VIP proposes 8 priority actions. We summarize them into 4 key areas. 1, to immediately conduct an employer survey to gauge employers' interest in hiring immigrants. As we heard, we have done a survey with immigrants themselves, but we haven't really heard from those who may hire them for work. So this action is already supported by local business improvement associations, the Angus Reid Foundation, Mosaic, and the Immigrant Employment Council of BC. So we're looking at implementing that quite shortly. 2 is to build on Healthy Cities Strategy's recommendation to develop stronger social procurement policy and process. 3rd, gather data and assess mentorship programs among diverse professional sectors and whether they are inclusive of skilled immigrant professionals. We heard from the immigrants themselves that actually mentorship is a very viable form of learning about local workplace culture and access. And in fact, the city itself has a newcomers mentorship program, which has also been very successful in helping skilled immigrants. And finally, a recommendation for convening more networking events involving businesses, employers, and skilled immigrants themselves. I shall speak to it a little bit more later. Under the final theme, which is government and public institutions addressing needs, there are 2 key actions. The focus of this theme is how best to address cross-jurisdictional and systemic level issues which go really beyond the jurisdiction or mandate of one singular organization or even level of government. To that end, 2 actions are proposed. 1 is to create a data and information sharing structure among key stakeholder groups. For example, the city undertook many research ourselves, but how do we best align those research findings with, for example, coastal health or the provincial government and other levels of government? So that is very important. Secondly is to identify a collaborative leadership model that advocates and promotes the well-being of immigrants and refugees at a systemic level. So as you see, the previous 3 themes quite specifically address issues, but under this area, the strategy group actually looks at very broad range issues, which is totally sometimes beyond the mandate or jurisdiction of one level of government or sector. So such as housing, employment, and many others. They are not really within the mandate of the city alone, but we need to work with other levels. So as for next step, with the launch of the New Start strategy, what are our next steps? Today's presentation at Council is the official launch of VIP strategy. For our next step, VIP will be inviting all our current and also new partners to attend a launch meeting in early October. The focus of that meeting is to engage current and new partners in developing action plans that are considered implementable within a reasonable time frame. The meeting will also identify actions which can be implemented within existing city or community programs, or community partner programs. But we will be also looking out for new partners and funders to engage in supporting the implementation. We do want to note that the current LIP model requires that VIP Secretariat to leverage support and funding from community partners, the city, and other interested funders. And at this point, I do want to acknowledge Nadia Cavallo, who is our VIPS program coordinator since its inception and also assisted with the preparation of the presentation today. But by way of an example of implementation, earlier in May, VIP hosted with the Laurie Institute to launch the Diverse City on Board program in Metro Vancouver. And following that, we also work with some community partners, including Peace Geeks and Immigrant Employment Council of BC, to host a very successful technology sector networking event, which is actually one of the proposed priority action. The event itself attracted the participation of 8 significant employer groups, including Hootsuite, Slack, Electronic Arts, and the city's own Digital Strategy and Information Technology Department. And 60 skilled immigrant professionals attended the event with great interest. We'll be carefully evaluating this prototype event and engage with other partners and sectors to consider undertaking similar events in the future. Finally, VIP is committed to assessing the progress and outcomes of all the priority actions, and we will report back to Council when needed in the future. We'd like to conclude this presentation by acknowledging the support we have received from the federal government, the Mayor's Working Group on Immigration, our incredible community partners, civic departments, and government partners who have helped make this strategy possible. For those interested in the New Start strategy, please go to the VIP website, which is VancouverImmigrationPartnership.ca. At this point, Mayor Claire and myself would answer any questions that Council may have regarding VIP and the strategy. Thank you for your attention.
Thank you. Councillor Genova.
I just had one question regarding, you had mentioned the 3 types of spaces or places that are most used, or that was the results of the survey, and those are our most public places that offer free access. So we're looking at the libraries, the parks and gardens, as well as I think the third was the community centers. So in moving forward and working with sort of our park board and looking at how that may affect things as well, has there been any discussion about partnerships? I understand we're dealing with this at the city level, but is this going to park board at all? A strategy similar to this?
So yes, they've been involved in also developing the strategy, and I think both the libraries and the park board are very pleased to know of the result of the findings. Actually, 93% of respondents indicated they have used library services, during the time they're here. So we know that, but actually most of the civic services that we asked people to indicate got fairly good indication. Like I think everything goes beyond 50%. So most immigrants seem to have used some civic facilities or amenities. But we'll be working with the park board and the library board as well to look at how increasing even more access to the programs or space. And there's some current initiatives that we're talking with them as well.
Okay. I also had a question about, did you at all survey them about resources, where they were best able to find resources, and were those places, maybe not so much parks and gardens, but was the library and the community centers sort of a hub or a resource for them? I'd just be interested. I don't want to put you on the spot. I don't need the data right now, but it would be nice to have. And I also just want to acknowledge, I just noticed that Commissioner Erin Shum, the vice chair of the park board's here as well. So ironically, I didn't see her there until after I'd asked the question, but I'd just be interested to know if that's where the first line of support, I guess, they're seeing for resources is.
Well, from what they told us, it seems like they heard a lot of it through friends and family. That's sort of one key point of referral, and also a website, and it could be helpful. But as I also mentioned, that many of them actually don't know about existence of services, so they don't necessarily get the information from service organization. So in the next round, we will be probing a bit more into how they learn about these, get this type of information. And we actually will be working with a number of groups to promote, in fact, the knowledge about services to the broad immigrant community.
Wonderful. And just another question again, it's more of a database question. I don't need the answer now, but if at some point in the future, are there certain neighborhoods that have, I suppose, are you collecting data to see which neighborhoods have a higher population of immigrants or refugees that are looking for these services? Is there any way to sort of, how would we find that out? Are we looking to our community centers to help us to gather that information to see where we could kind of move forward in serving immigrants and refugees better? I suppose if there were neighborhoods that had higher demands.
We generally know where immigrants live within the city and in what neighborhoods, so that is actually data available from census. However, to drill further down into what type of services they use or not use, if it go back to the survey itself, we do have that data, but the data may not be comprehensive enough because we only receive responses from 1,800 people. So we may have to do more kind of a rigorous type of random sampling survey if we want to get to that level of understanding.
Okay, you mentioned that you do know where they are, I suppose, the highest populations are.
Yes, we do.
Can you comment on that?
There's large numbers. In fact, it's very interesting. If you look at the numbers, almost every neighborhood in Vancouver have significant number of immigrants because, as I said, 48% of all residents are immigrants. So, but we do know there are a couple of neighborhoods which have lesser number compared to others. But so we do have that kind of data on hand. But as I said, I think almost all neighbors in Vancouver, have significant numbers regardless. There will be 25% and more in every single neighborhood in Vancouver.
Okay.
Yes.
Thank you.
Thank you, Mayor Robertson.
Thanks, Mr. Chair, and thank you very much, Baldwin, for all your incredible work on this front, your great support of the Mayor's Immigration Task Force, which is, we've kept going for many years now, several mayors, but I think as the working group is on immigration is stronger, and I think the work that we're seeing today, the culmination of many different efforts coming together is really extraordinary, and your leadership's been essential to this. So a big thanks to you and Nadia and Lanny and the team that are working on this here at the city. There's been great support among city staff from different departments as well. And I want to take the opportunity to thank the strategy groups too. We have a lot of people around the city who've contributed to really bringing the best forward and figuring out the best way to support immigrants and refugees. And this is essential work to our city. I think we're lucky to have so many experts here in Vancouver at this with learned experience and lived experience, and that's enabled, I think, a really fantastic, this new start is, I think, a great culmination of those efforts. So a big thanks to all the people involved, as well the advisory committee of the VIP, the expertise there as well. So it's, I think we've got a lot of important work to do ahead. I'm emboldened by the work here at the city level and the fact that we're at a point where we've done enough work on this, and we really need to work on promoting it to immigrants and refugees so they know what is available here and the depth of support that's here. There's one point in here that talks about the hopes and aspirations we have to expand this work across Metro Vancouver and at a regional level, and it came up at the last immigration working group meeting. And I'm curious if there's been any advances, if we're seeing uptake from other cities around the region, and as a lot of our experts work around the region, so there's obviously capacity. I'm just curious about the integration and the connections and how that's going.
You raised a very important point, Mayor. So as I said, only City of Vancouver and City of Surrey are conveners of a LIP program. But from our understanding, talking to other Metro, at least the Metro LIPs groups, sometimes they actually have challenges accessing or working with the local governments. So, and I won't name whichever, but sometimes it's not so easy for a non-governmental group to approach the local government to partner with them. So we are in a very fortunate position of having the city itself convening. Actually, I learned though that throughout Canada, other in Ontario and other parts of Canada, many LIPs are actually can be hosted by local governments. So apparently the federal government is very interested to engage with local governments in this way. And I think they realize the benefit of having local government involved. So we're expecting them to come forward with some renewal of our contract in a short while. But there's some challenges, as I mentioned. Also, LIP itself, the funding is restricted to only certain, for staffing and other purposes. So it will be an ongoing challenge, and to maybe bring to the attention of the federal government that the implementation requires a lot more support. And it's cannot be only from the city, it has to be from many sources. So we are approaching other funders at this point, but I guess it will be an ongoing challenge in some way. Yeah.
In terms of the funding from the federal government related to settlement services, and is the LIP funding in that same bucket of funding?
Absolutely. It is in the same total settlement program. It's called the indirect services. So it's considered not a direct service program, but it's all part in BC. They funded over $100 million in settlement services, including LIP.
That all flows through the province first and then?
Yes, now it's under the federal government.
And I know years ago there was concern that the BC government wasn't investing all of the settlement service funds from the federal government into services. Is there a current analysis of whether that funding is flowing through?
Well, it's a point of contention between the levels of government. However, I think some of the points made, though, has to be said, though, is that the federal government actually has a restriction as to who are eligible for their services. So they actually only would allow for people who've been here quite recently, in fact, the last 5 years, to be eligible. So, but many immigrants may in the first years may not be able to access those services or whatever it is, like even English language program. So many of them can only access afterwards. So the provincial government do allow for that under their, when they administer the program, they allow for other immigrants to access the services, which actually, according to the federal government, they don't allow for. So those are the kind of a bit of contention.
Okay. Thanks for the great work.
Yes, thanks, Mr. Chair. Thank you again for, like the others have said, for the incredible work that you're doing on this. I just have one question, and it really relates to a different source of funding altogether, which is the Vancouver Foundation and City of Vancouver's Neighborhood Small Grant Program. Mm-hmm. In reading through the report you provided to us, it seems to me that personal connections make such a big difference in the lives of new immigrants. And I'm just a big fan of those little neighborhood projects that are all about bringing people together. I'm not sure if you have yet contacted people who administer those grants to give them a briefing, really, yes, on how to try and outreach and incorporate new immigrants in it, but I would encourage that.
Very good point. So actually, after this official launch today with Council, staff will be contacting all these major groups such as Foundation, Van City, United Way, and others to present to them this whole strategy as well. Yeah. They're already involved in different ways with the development of the strategy, but now it's time to talk to the bigger groups in a different sort of way to get there.
And our staff too, of course, yes, here that are helping administer those grants. I think that just a heads up to keep, because I know they've got so many things on their mind, but I think this group in particular would benefit so much for those wonderful connecting projects.
Exactly. So we're committed to doing that.
Great. Thank you.
Just a quick, just wanted to thank you, Councillor Meggs, for your work on the co-chairing the working group on immigration. You got to do it quietly behind the scenes on behalf of all of us on council, and help keep it together and channel that into the council work. So appreciate your work on this front.
Wong on the spot on about federal funding, because what is demonstrated so repeatedly by the work, I think you laid it out here today, Mr. Wong, is that although there's a federal and provincial responsibility for support of newcomers, all the services that they mostly rely on are delivered municipally. And in the absence of consistent and sufficient funding, the whole immigration project kind of winds up being transferred to the shoulders of municipal governments, only a few of which are funded to bear it, and then only on a contractual basis. So I hope we do see some reform in that front, because it's critical to the success of people arriving here, and I think critical to our community maximizing the benefits of their arrival, which remain invisible to a lot of people who've been here for a longer period of time. So thank you very much. That's all the questions, and sure we'll hear more about it, and I hope we're able to get more money, as always, for everything.
Thank you.
Okay. Moving along, it's Healthy City for All, an update on enhancing access to food. I don't know if anybody's working today in your department, Ms. Eck, or if everybody's here, but it's...
So I'd like to, we're pleased to put this report forward. It's an update on enhancing access to food in schools and one recommendation to Strathcona Community Centre Association's Community Breakfast Program. I'd like to introduce Sarah Carton to you. She's been our lead planner on this project, and she's got a short presentation, and then we'll be available to respond to questions. Okay, go ahead.
And I'll just flag that Nancy Brennan, the Associate Superintendent, as well as Jessica Land, the Supervisor of Enhanced Services at the Vancouver Board of Education, are both with us today as well. So the city's focus on school food is grounded in actions in both the Healthy City Strategy and the Food Strategy, and in particular an action to facilitate school meals and food literacy development as a way of ensuring that children grow up healthy. In 2014, Council expanded access to healthy foods for students through a $400,000 per year or in ongoing funding. The funds rolled out at the end of 2015 and were divided with $320,000 going to the Vancouver Board of Education's Food for Schools program and $80,000 going to Strathcona Community Centre Association's Community Breakfast program. Last year, Council directed $50,000 for a school meal program evaluation that has since been conducted and $75,000 for an alternate meal model that aimed to align meals with city's other goals, including food literacy, zero waste, and local food sourcing. Council also asked staff to report back on the number of students still needing meals. Children are living in poverty in every census tract in the city. Citywide, the poverty rate is 22%, and Strathcona neighborhood has the highest rate at 70%. These statistics are aggravated by stagnated income assistance rates and high rates of working poor, which has led to Vancouver-wide student need for support. This map shows the Vancouver Board of Education elementary meal programs, which correlate well with census area poverty levels. The dark blue points are those schools with a universal hot lunch program, and most of these schools also offer a breakfast program. The white dots are those schools with a delivered breakfast or lunch. These include the 17 programs that are funded through the city. The grayed out schools are those schools without any formalized meal supports. The school board has provided a school meal program for students at risk of hunger for over 35 years. They serve approximately 3,500 meals daily to elementary students. The city's $320,000 contribution covers the lunch costs for 258 students. The province contributes $2.4 million towards food supports for elementary and secondary students, meaning the city's contribution represents about 12% of the meal program costs. The city's financial support to Strathcona Community Centre Association's Community Breakfast program covers 80% of the costs and provides meals to about 120 student and family members, as well as student and volunteer leadership and food skills training opportunities. Their program also benefits from over 100 volunteer hours per month. The Social Planning and Research Council of BC conducted an evaluation of both programs earlier this year. Both programs were very well received by staff and students. For the portion of the school board's program that's funded by the city, the evaluation found that stigma was not identified as a concern by staff or students, which was great to see. It also found that staff noted improved attendance and classroom behaviors. Another finding was that grade 4 to 7 students reported the meals were too small. The school board offers supplemental baskets of food for schools to order and will ensure schools are aware of this process. For Strathcona, the evaluation found that staff and volunteers felt the student volunteers had increased skills and confidence to prepare nutritious food, as well as improved self-confidence and leadership skills. The students had increased positive attitudes towards breakfast eating and eating healthier food, and students, staff, and caregivers all reported increased social connectedness. As I said, the Vancouver Board of Education provides 3,500 meals daily to elementary students. 1,150 of these lunches and 600 breakfasts are completely free, and the balance are a mix of parents paying, partially paying, or fully subsidized. The VSB estimates, based on the Ministry of Education's Social Services Index data, that there are an additional 250 students who may require food supports. These students attend 52 different schools, which means an average of 5 students per school. The needs may go well beyond the numbers identified by the Social Services Index. With a 22% citywide poverty rate, there are over 6,400 elementary students living in poverty. The links between income security and food security are well documented, and we can predict that these students are living in households that are stretched and stressed in trying to make ends meet. To expand to feed the 250 elementary students identified through the Social Services Index or to the 6,400 living in poverty, there are significant challenges. In terms of infrastructure, most elementary schools do not have kitchens, cannot do on-site food preparation. The 4 high school cafeterias that are operating as catering kitchens for the elementary schools currently don't have space to increase production. In terms of staffing, most schools do not have any on-site staff whose job description or training in the union contract allows them to handle or hand out food. In terms of distribution of need, students high on the Social Services Index are located across 92 schools total, which includes 52 additional schools that currently have no formalized meal supports. And of course, the most significant challenge is ongoing high poverty rates in the city that need to be addressed. Moving forward, staff recommend continuing to support the Vancouver Board of Education's and Strathcona Community Centre Association's meal programs based on the positive meal program evaluation results. There's already an agreement with VBE until June 2018. Staff recommend that Council renew the $80,000 grant to Strathcona Community Centre Association for their breakfast program. School board and city staff will continue to meet to discuss a long-term approach to feeding students and funding meals given ongoing high child poverty rates. School meals represent a new area of collaboration for the school board and the city. While recognizing hunger is an urgent need, it's important to establish a shared vision to determine the roles that the city and funders can play and how to build on the school boards and other stakeholders' good work. Staff plan to carry forward the one-time $75,000 allocation pending further conversations and identification of priorities. The hope is that with the development of stronger partnerships with the school board, funders, and other stakeholders, the funds may be leveraged and applied strategically to meet the needs of students in the long term. That's it.
Okay. Ready for questions? Councillor Carr has a question.
Yes. Thanks, Mr. Chair. Thank you so much for the report and the fact that we are helping kids that are really in need in terms of food and nutrition. My question really arises, and thank you for reporting back on what the gap is. And so if I look at the report appendix, well, it says right in the very beginning on page 1 that it's 250. There's about 450 students, but 250, I gather, are ones that have really identified for the needs. And then in Appendix B, page 1, it says that we've identified them, but it appears to me that we can't do that we're not doing anything about that because they're in 52 schools and it's very difficult. So what is our plan?
Mm-hmm. I think the plan is, we're still in conversations to figure out what's the best way to meet it. As I outlined, there's some of those challenges that are making it fairly difficult. I think you'd also asked around costing of some of the, whether that was possible. At this point, I know the school board has said costing wouldn't even be possible because at this point, there's no way of actually meeting that need.
Yes, I understand that's the answer, but it's not very satisfactory when you've got 250 kids. So I'm just wondering what are the thoughts about the ways to move forward?
I'll just add a little bit. I think what we've learned from, say, places like Toronto has been that there have been made some advances in terms of having something like the Strathcona program available at more places. I think that program is actually well known across Canada for being one of the best meal programs in the country. How we go about doing that, I suppose, is the question. So we're enlisting actually some support, some help from places like Toronto, like Detroit, and elsewhere who have run up against obstacles around feeding hungry children in schools and have gotten to the point or the place where everybody gets a meal. Mm-hmm. And I think that's the vision that we would want to have, is that everybody gets a meal at school. So we're taking some steps to get there, but we really need to, I think, garner some expertise from understanding what other areas have done, other jurisdictions, to help guide the way on this.
Okay, yeah, failing getting to that point, which I agree is a great goal. What I'm understanding now, you're not giving up. You are working.
Absolutely not.
With the Board of Education around trying to find some solution.
Absolutely. Okay. It's really very important that we do so.
Okay. Well, I look forward to a report back on that.
Thank you.
Thank you.
Okay.
Councillor Genova.
Hi there. I'm just looking on page 3 of the report, and in the City of Vancouver funded school meals, I'm looking here at the cost of the meals, and I understand that the Community Centre Association at Strathcona, and I know that there were some big shoes to fill after Ron Suzuki just left, but I know that they're doing a great job, as they always have done. I see that the Vancouver School Board meals are $7.09 per lunch, whereas the breakfast provided by the CCA is $2.82. So I understood the amount of food, and in going through that, could you talk about the reason that it's priced so much less?
Sure. Sure, and even looking at page 4 helps a little bit as well, because even for the Vancouver Board of Education's meal programs, they also have, their on-site breakfast program is also $1.80. So a number of factors end up increasing the cost. Firstly, having an on-site meal program is a lot cheaper. You do need a kitchen to do that, though, which is one of the big barriers. But if a school already has a lunch program, then to extend a few more hours for a staff person to be able to offer a breakfast program doesn't add a lot of cost, which is why breakfast can be offered much more affordably if you have that model. You have a kitchen, you have a staff person on site. But then you also add the delivery costs for those schools that don't have kitchens, and that's what increases the cost then from more of the on-site lunch of $475 up to $709 for the delivered lunch.
Okay, so really you cut every cost you possibly can for the breakfast program. I'm very impressed, and I want to thank you, because I see that for $2.82, I agree with Councillor Carr that, I mean, there needs to be more, and I was shocked to hear that, you know, one of the complaints is there's not enough food, or, you know, kids are still feeling hungry after they have breakfast, but I suppose that certainly is an issue. Another question I have is regarding RACAM. So RACAM and Strathcona, I understand, both have or share in the backpack program as well. Can you address to any of the kids in the catchment area for schools? Do they, from the RACAM area or that RACAM serves, are they a part of the Strathcona Community Centre Association breakfast program? Are we meeting the need? Sorry, that's a lot of questions, but I'm thrilled to see the report and the numbers and costs broken down here. It's amazing what you've been able to do with so little.
To answer the question around RACAM and the ability for other students to attend Strathcona, even schools from students from Seymour and elsewhere, Strathcona says they're open to all other students attending. The reality, though, given that you've got to be at school at 9 o'clock, most students aren't going to come to Strathcona unless you're typically a Strathcona student or a sibling or a family member. So that's the main part of that.
Yeah. What I'll also ask then, now that I have that answer, is there a need beyond, well, I know there's a need throughout Vancouver, as you've said and stated many times coming back here, but another question that I have is regarding that area, especially sort of the inner city. Are the amount of meals that are being served at Strathcona, even if you could serve more kids breakfast, as you said, there's constraints of getting kids to school. So is this the only program there should be, or would you be looking to expand that program? I was wondering if you could comment on that. Sorry, I know it's a very broad question.
That's all right. For Strathcona Community Centre, I mean, one thing I should mention, what the evaluation found, that they're quite space constrained. So their ability to serve all the kids, even from that school at this point, is actually impossible. So they have about 120 people per day, but that includes family members. So it certainly doesn't meet the need, knowing that the poverty rate is 70% in that area. And I think, I'm going to guess here, but I think the school population is fairly large, maybe 550 kids or so. So certainly not even meeting the need within that one school. The map that I showed earlier on that highlighted the schools in the inner city area that had the blue dots on them, it's also in the report. 8 out of those 10 schools also have a breakfast program, so that's operated by Vancouver Board of Education. So that's another way of trying to meet the need within those inner city schools. But I would say there's an unmet need. I mean, there's many kids who also don't show up to breakfast generally, and so there's sort of more kids tend to show up for the lunch portion of the program.
I was also going to, another question that I have is how kids access this program. I assume that there's some kids whose parents, reach out and sign them up. Others come through teachers or through programs at the community center. Where do you find that most of the kids who come to the breakfast program, how are they referred, or how did they get there, connect? And is there a big disconnect with the kids who need it most, not having that person to connect them to the program?
I think it's an interesting question. I think a lot of it's school staff who typically identify kids who might benefit from one of the programs, especially for something like the bag lunch program. The data that comes in, the social services index data, identifies the number of kids per school, but not the students themselves. And so then it's up to the staff at the school to figure out, well, we get a sense this child here is going to benefit from the lunch program, and they'll send home a waiver and they'll get them signed up for it. So I think that's one process by which kids are identified. What else I was going to touch on there?
Well, I'm over time, but if I may, Mr. Chair, I was just going to say, what I had already said was, I was just wondering, is that where you see most of the kids come through the breakfast program, or do you find it's parents reaching out? How do you, the majority of the kids, how do they get there? How do they connect with the breakfast program? Is it the parents? Is it staff at the community center or the schools?
And this is specific to Strathcona or to all breakfast programs?
Well, I'd say to Strathcona. I'm interested in all breakfast programs, but mostly Strathcona because that's what's...
Just, I think the short answer, we don't really know, right? You know,
Okay.
it comes from all kinds of sources, and we didn't ask that question specifically in the evaluation.
Okay, thank you very much.
Thank you, Councillor Ball.
Yes, thank you very much, and thank you for the report, and obviously for all the work you're doing. I was recently traveling in Europe through a number of schools and noticed that they had portable kitchens because the buildings were old, they didn't have kitchens in them, so they were bringing in portables, very much like our portables, except they could be moved. And I was just wondering if that has ever been considered. I was given tours, and throughout the day, the staff actually do classes in how to grow food, use the food, access it. And I'm just wondering if that might be considered as something that would be useful or interesting, or has it been contemplated?
I'm not sure that it's been contemplated. Our Vancouver Board of Education staff who were here, they just say that we're still may be a concern around space constraints, but it's something that we can bring back to them and talk a little further about.
Excellent.
Thank you
very much. Thank you. And congratulations. Against all odds. Thank you.
Thank you, Councillor Reimer.
Just a couple questions, mostly on totally on the reporting. So this fantastic report, it's been a year, not even a year now, a school year. So there's two programs. There's the breakfast program and then the lunch program as discussed. When would we anticipate the next report back on the two?
I think, yeah, well, Sarah was suggesting perhaps at the end of the school year. I think it would also be helpful to report back after further discussions with the school board and efforts to look at how do we perhaps expand a model program that we come back to you then when we've had further discussions on that. That'd be helpful.
You know exactly where I might have been going with that,
Yes.
which is my anxiousness to get to the discussion of the model program, understanding that there's a lot of data that we need to gather to get there. But so we'd be looking at sometime after June 2017.
Yes.
Okay.
Yeah.
For reference sake, my memory is we are the only country in the G7 and perhaps even the OECD that does not have a national school food program that would be available to every child in school. That's correct.
That's correct.
So as a result, we can't take data from any other country because it's not applicable, because they're not cherry picking kids the way we sort of have to do given the lack of national food program.
That's right.
Okay. Okay. Chairperson, I'm prepared to move the motion in the report and to speak briefly to it.
That sounds good. I don't see any other questions, so please go ahead.
So many things to be said about this, not the least of which was that last point, that it is somebody on the Violence Against Women report that we just had, I think it was you, Councillor Stevenson, was asking why Vancouver was doing so poorly, and actually the answer to that was in the earlier reports in the day, which isn't Vancouver doing poorly, it's that we have a province that lags so far behind the rest of the country on basic supports around housing and mental health and addictions. And in this case, we have a country that lags so much behind the rest of the world in terms of its support for children who have, through no fault of their own, find themselves in circumstances where they're going to school without food. And the way to deal with that isn't to draw a giant red line around the child and say this child is living in poverty and we're going to provide them with food, but to ensure that every child has access to food so that you're not trading hunger for stigma. And I think I'm still very grateful that the council was willing to support this program, because going hungry is not the way we want our kids starting school, but to say that the model program that we'll be able to support will need, in my opinion, to include very strong and consistent advocacy to the federal government for that national program, and in the absence of their action, a province that can see their way to supporting every child in school. I could say so much more, but I'm kind of anxious to get to the living wage discussion because that, of course, like going back in the full circle here, that is another way that we would be able to support families in supporting their children better and going to school. So I anticipate people will support the continuation of the breakfast program, but to really put a marker down that this is really, you know, the floor, not the ceiling of where we need to go as a society with this.
Thank you, Councillor Carr.
Thanks, Mr. Chair. I'll speak briefly to just thank staff again for a very good report and for the update, which really paints the picture for us, and to be very clear that it's simply not acceptable that we have children in school who are hungry. And so we have to work at making sure that there aren't any who are hungry, and that 250 that we have identified need us to find a solution. And I know it's multiple level of government and it's difficult, but I am going to encourage you to keep soldiering on with finding that solution for those children. Thank you.
Thank you very much, Councillor Carr. So we'll go to a voting screen, please. So all those in favor of the recommendations, clear off the one that's there. So can you set the screen again? Okay, all those in favor of the recommendations? Councillor Jang, did you vote? Yes, I did. Councillor Ball? We'll try again. Okay, there we all are. It's unanimous. Thank you very much. So thanks for that report. We'll now go on to F. There is a report on F, but not a presentation. So does Council have any questions for staff on the Senior Centre in South Vancouver? Nope, that's not me. Councillor Carr, do you have questions?
I actually do. I seem to be a holdover, but I was going to press my button and there I was. So already. So yes, I do. Thank you.
We even had a lightning recess. I don't know who was pressing the buttons, but
no,
quickly.
You just let me keep on going, which is great. So I do have several questions, and my first question is what consultation have we undertaken or did we undertake with the Park Board? I mean, I know that we made this decision, but I'd like to know what the consultations were prior to that.
Thank you. Danica Jurkovic, Director of Facilities Planning and Development. We had some discussions with the Park Board staff as well as Park Board commissioners on following up with the Killarney model, as report states, and they were quite pleased in kind of doing similar model here in Sunset area. They also adopted on their Park Board meeting on Monday that this report moves forward, and we received their full support. As far as consultation, we would try to connect with we will connect with all of the appropriate user groups which were mentioned in the report, and they have been notified of this discussion today as well. So,
right, that's it's my only question. That I just wanted to make sure that we are in good communication with the Park Board on this.
Yes.
And the prioritization. Yeah, great. Thank you.
Good.
Thank you, Mayor Robertson. Did you have questions?
Actually, no, I didn't have any questions. I was just prepared to move.
I'll advance the queue. Councillor Genova, do you have questions?
Yes, I do have questions for staff. I understand that the Park Board passed a motion. I believe it was actually Commissioner Shum's motion that was passed, and it was similar to the Killarney model, where the Park Board is exploring the possibility of perhaps providing the land for the project. I understand in the motion that came to City Council, I actually asked Councillor Louie to include, and he did as a friendly amendment, that the Park Board would be included in that. Are there any plans to explore that land now that the Park Board has, I understand, unanimously passed Commissioner Shum's motion to consider Park Board land? Does that give more opportunities in that area for the project, because it was very specific to the Sunset area?
Yes, of course. I think, in staff report we try to show examples how senior centers work really well within context of community centers, which obviously sits on Park Board land. And as I said, we are very much aligned with Park Board on this as well. We didn't want to preconceive the notion that that's the best and only solution. So we will do some feasibility on different sites and options and come back to council and Park Board with our recommendations. I guess the beauty with Killarney model or Kerrisdale model, which are senior centers adjacent to community center, is that we can actually use our space much more. So capacity is much greater because seniors have certain time in a day where they use the center, and the rest is available for potentially youth programs that are also in great need or other community center programs. So there is value there in ongoing sustainable operating model, as well as newer health studies which our social group colleagues are showing over and over again. Seniors of today are seeking to be very much integrated with youth and others. They don't perceive themselves as isolated group. We are going through discussions now with Britannia on that, and they are very adamant that they're not kind of seniors that we are used to from 50s, and they very much want to stay active, connecting to recreation, connected to youth, to food programs, and so on. So, there are some learnings and experiences along the way, and we look at everything.
I previously was the liaison for Park Board to the Seniors Advisory Committee. I believe Commissioner Shum is. I know that Councillor Ball and Councillor Stevenson are council liaisons. When would you be bringing this? How often would you be consulting with the Seniors Advisory Committee? I seem to remember during Killarney there was a lot of stop and go as the city was trying to find the funds itself, and the federal and provincial funding had to come into place. The original motion that was passed that came forward didn't specify the funding. So I have two questions. My first question would be regarding the funding itself, and then also the consultation with the Seniors Advisory Committee. So what would we be looking at? Would we be looking at a similar model of funding where we would ask the federal and provincial governments to contribute? And if so, do you have a number for what that may cost? Because since Killarney, I mean, that started 10 years ago. Costs have gone up, obviously.
Yes, well, that's exactly, this would give us sort of green light to proceed and approach federal and provincial government, and you may recall that we are much more organized when it comes to grants and partnership with other levels of governments. We have created good contacts with them, and we would attack that one first. So yes, our expectation is fully that they would help us get the funding and meet our goals sooner rather than later. When it comes to budget, it's hard to say. We managed to get Killarney Center tendered and within full project budget for $7.5 million. I don't want to give you a number, but that's exactly the type of work we will do now. So we committed that through a consultation with all senior groups, as well as association and senior advisory committee. We will first focus on programming to make sure that programming is okay, and then once, depending on the site selection, that may also impact the cost. So that will be part of our future report. I can tell you for sure it will be more than 7.5. That's all I can say for sure, but
Okay, and with the park board's, I suppose, signal of support through their motion that they're willing to move forward, and there's more land options for where the center can be, and as you said, possibly near the Sunset Community Center, another center, as the models move forward, and you see what works. I'm wondering, as you go forward with that, will that help the project move more swiftly now that the park board has stepped up and said that they will come on board to help?
Well, certainly we are looking for all the partners to help us get there faster, as I mentioned, including park board, provincial and federal government as well.
Okay, thank you. I was prepared to move the motion, but I know Mayor Robertson wanted to do that. So.
You got seniority, Councillor. Thank you. So it's been moved by Mayor Robertson. Is there any debate? Any further comments you want to make, Mayor Robertson?
Yeah, I'm happy to move, and just want to thank staff for being on this and a quick turnaround to bring back this update and next steps with feasibility study. And thanks to the Park Board for their willingness to partner on this as well, and Commissioner Shum's leadership on it. There's obviously, hopefully, a good opportunity there at Sunset, at the community center itself, that makes the most sense, and this is the most effective and efficient way to do this. And please keep us posted on work that we can do with our federal and provincial counterparts, because we would definitely like to see them, as we did with Killarney. We were first in saying we want to do this and we'll put our share on the table, and we did that with Killarney, but it took a long time to get the other two levels of government to be there with their matching funding. So hopefully this time it goes much more smoothly with those levels of government, given the resources available now, and what we've been hearing behind the scenes. So hopefully we can get this moving along at a good clip here, and really appreciate all the efforts made by staff and Park Board and the community on this. Thanks.
Thank you, Councillor Genova.
I'll echo some of Mayor Robertson's comments. I'd really like to thank staff. I know that it's just almost a deep breath because Killarney's not finished yet, but we'll get there. I know that Lorna Gibbs is looking forward to using her shovel. So I just really, a huge thank you to everyone who has come together for Killarney, and I hope you had a little rest in between. I'm really looking forward to seeing another senior center. I know that the research that I did when I was on Park Board and here at City Council shows that originally there was maybe 20,000 seniors that we sort of had identified to use the center. Then the number went up to 28,000, and that was just to serve a portion of the southeast part of Vancouver. We will only have one senior center in East Vancouver that's officially a city or Park Board owned facility. So I'm looking forward to seeing more. We have more on the west side than the east side. We need to keep providing facilities and resources for our seniors and engaging them, and I'm really enjoying the approach that it's going to be integrated, and we're not going to have a segregated building off to the side somewhere that you only get membership when you turn a certain age. So I'd like to thank our staff. I'd also like to thank Commissioner Shum for bringing the motion forward at Park Board. Phew, we don't have to send Mr. Ojla out looking for space, or any of our other staff. I think that it's fantastic to look at partnering this with other recreation services we have. So very much looking forward to seeing the plans and the consultation with all of the committees, neighborhoods, and groups that will be using this center. And again, very happy to support this.
Thank you, Madam Clerk. Could we see a voting screen, please? Okay, all those in favor, please show. And that passes unanimously. Thank you very much. So making the City of Vancouver a living wage employer, thanks to those who waited patiently for this item. Mr. Moke, do you have a presentation? Okay.
Thank you, Mr. Chair, Mayor, members of Council. Paul Mokry, Deputy City Manager. Do we have the? Sorry, we're not showing it on the. Oh, it's coming. Well, while that's projecting up, Mr. Chair, you have a report in front of you today from staff, which is in follow-up to direction from Council from last July 2015, to report back to you on this issue. The report sets out a series of 6 recommendations, and I'm going to walk through the context for those recommendations as quickly as possible, appreciating that you do have speakers here to address you.